Hi, everybody. Welcome to the Abington School Committee. Meeting tonight is Tuesday, September 28th, 2021. Kevin, are you ready for us? Perfect. I'd like to call the meeting to order, and if we could all stand for a flag salute. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks. Before we start tonight, I just want to say a couple of words. So, thank you all for coming. I just want to point out a couple of things. So, over the weekend, there was a blog posted regarding the location change of our meeting tonight. It said that the 4 other members of this board were not informed ahead of time and that I did not seek permission or ask for a vote to change locations. This is true. I did not. Peter and I changed the location on September 10th. The members found out once they received their agenda. Although the town blogger and a few parents try to imply this was done in a nefarious manner, I'd like you to know it was not. The school committee is not the PTO or the PTA. We're elected officials. We are a town board. We are not tied to meeting in a school setting. We meet in our new middle high school in order to show it off to taxpayers and community members in attendance. Previously to our new school building being built, we met at the town hall with an occasional meeting in this community room. I asked Peter to change locations to either the Cotter Room in Town Hall or our public library. Peter let us know that the town hall was booked and the APD was open. Every other elected official and town board in Abington uses the town hall for meetings. There is no mask mandate at the town hall. Attendees are not required to wear masks at those meetings unless they want to. Our town manager, the Board of Selectmen, Board of Health, Planning Board, Housing Board Authority, Zoning Board, and I'm sure I'm missing more, but have met this month alone. And all of these boards, with the exception of the BOH, were either completely unmasked or only had one member masked. I believe our school committee and our attendees should be afforded the same rights as the others. Moving this meeting was not meant to be a big ordeal. The agenda listed the meeting location, and Teresa sent an email to the members letting them know the location was changed 4 days in advance of today. Changing the meeting location did nothing but allow more people to be included and allow our members the same rights as every other elected official in this town. Please don't tell me that changing the meeting location prohibits those that want to wear masks from coming. We have had 2 meetings since the mask mandate came into effect. The first meeting was filled with parents against masking, and the last had a handful of parents at it, and not one person spoke out for or against masks. And the infamous letter to Desi was on that agenda as well. So to say it's not fair because there is a mask letter on the agenda is just bogus to me. For anyone that complained on Facebook, where have you been at the last 2 meetings? Where have you been over the years? I've yet to see many of the keyboard warriors even attend one meeting. Those that complain, I'm sure, did it out of spite or who they're friendly with or related to, and that's fine. I have no problem defending myself, my actions, my thoughts or this board as a whole. But I will not stand by and allow any member of this board or any other board to drag my name through the mud, and I will not willfully give information any longer to hypocrites and town bloggers that pick and choose what they want to say, ask, and report. For all the years I've been on this committee, it's been about the kids. It's been about policies and teaching and learning. We have come so far with communication and transparency. For anyone to say otherwise, I take great offense. Even though the last couple of years have been turbulent due to COVID and mandates, the prior board always gave their opinions, no holds barred between us. We shared our thoughts openly with each other, disagreed and agreed, and always moved on. It was never personal. It was always about our students and staff. If anyone on this board or outside of this board has an issue with me, someone else, or something posted on the agenda, I'd appreciate you coming to me to discuss it first before going outside to speak to reporters. The town blogger let this community believe we are a hot mess. It's a location change. We are 2 minutes away from the middle high school. We are elected officials, and I ensure that we as a board and those in attendance are given the same rights as every other board in this town. As to the letters on our agenda, I'm not the only one that talks to you to talk to you about your As to the letters on our agenda, I'm not the one that you should talk to about your feelings on it. This is Peter. Peter goes over the agenda individually for anyone with questions. If there is something he can't explain or doesn't know, he will either ask or put a member in touch with another. This is a letter I brought to the committee for a vote. I cannot talk through it until we get to it tonight. So now that I've cleared the air, and I'd like to get back on topic, hopefully pull this community and this committee together again and just do what's best for our students. So thank you for listening. I'm going to open it to the hearing of visitors.
Wendy, before you do that, do you mind if I say
Sure,
something?
go ahead.
So my only issue, and I did send an email, was that in the past, things like that would have always been discussed between us as a group. This wasn't. That was my issue to start with. That's all I talked about to anybody about.
No, I
So I just wanted to
understand
let
that.
that be known.
No, I'm not taking any offense to that. So just to clear that, Peter and I have been in discussions, I want to say practically every single day, even weekends, 11 o'clock at night even. Like, we are constantly talking about everything that's going on right now with masks and mandates and vaccines and buy next now tests, everything under the sun. I'm doing research, he's working, I'm working. Like, there's just a lot going on that nobody was trying to say, oh, let's move the meeting, not tell anybody. Any one of us could have done that. Like, I'm sure.
That's not true.
Well, I'm not talking about you, I'm talking about Peter, Felicia, I don't know if you knew, but Teresa, like any of us could have done it. So it's not just me, like I was busy. I'm not like holding things away from anybody, but I don't have to ask for a vote
I know
on
you
it.
don't.
So,
I
right,
never
I
said
know
you
you, I
did.
know.
I said in
I
the
know.
past we would have talked about those things.
I just want you to know that any comment that I said tonight has absolutely nothing to do with you.
Yeah, I mean, whether it does or
So,
it doesn't, that's, yeah, it doesn't matter.
That's fine, but I just want to let you know that.
Okay.
Thanks. Okay, hearing of visitors. Who wants to be first? Anybody? Before we move on? Go ahead. Come on up. If anybody would like to speak, if you could just come up to the podium and state your name and address. Thank you.
Good evening. My name is Jennifer McLeod. My address is 468 Randolph Street. I want to start by saying thank you to every school employee in this town. For the last 18 months, our entire world has been turned upside down, and you have still provided ways for our children to receive an education. And for that, I am thankful. And I know many parents, all parents in this town, are thankful for that. So I just want to acknowledge that. I'm here tonight to ask for honesty. I'm here to ask for transparency. And I'm here to ask for bravery. 3 Facebook posts shared by our health department recently touted the success of masks. But to be honest, I've read many articles stating the exact opposite with studies to support their data and conclusions. Studies that confirmed, and I quote, relevant, undesired medical, organ, and organ-related system phenomena accompanied by wearing masks occur in the fields of internal medicine, neurology, psychology, psychiatry, gynecology, dermatology, ear, nose, and throat medicine, microbiology, epidemiology, and pediatrics, and that is a direct quote. There are studies from all of these medical professions stating concerns associated with mask use, prolonged mask use. Our conversation needs to change from are masks effective to are masks effective enough to justify the risks associated with our children wearing them for 6 hours a day. A mask risk-benefit conversation is the only genuinely honest conversation we should be having as a school system. Denying that there are negative side effects to mask wearing does not give the complete picture to numerous studies and also prevents important discussions. Will Abington as a school department acknowledge that there are potential risks associated with prolonged periods of mask wearing? Will you as a school department allow for discussions about these concerns? We know Superintendent Schaefer intended on leaving the decision to mask our children to the parents, and we're thankful for this. We understand your hand was forced by Commissioner Riley and DESE's statewide mask mandate. We also know that a public school can lose funding for not following the protocol set forth by the Department of Education. However, silent compliance to an overreaching order does not show Abington families and the Department of Education that the Abington School Department has the best interest in mind of our students and will not adhere to mandates that remove parental rights. I urge every member of the school committee to vote to approve a letter to Commissioner Riley and the Massachusetts Department of Education stating that Abington has concerns about the safety of masks and does not agree with Commissioner Riley's decision to impose this mask mandate on our schools. Since there is risk involved, the decision must be decided by individual families. 246 years ago, Abigail Adams stood on top of nearby Penns Hill in Braintree, watching a battle unfold on Bunker Hill in Charlestown. She wrote a letter to her husband in Philadelphia the next day stating, "The day, perhaps the decisive day, is come on which the fate of America depends. My bursting heart must find vent in my pen." Again, I urge this school committee, to find vent in their pen and write a letter to the commissioner against these mandates. Remember our roots and continue to fight the government overreach in whatever form it takes. If you think you're getting pushback from forced masking our children, you cannot imagine the reaction you will face when DESE tries to mandate the COVID-19 vaccine in our public schools. Make Abington's voice heard now at the Department of Education so that when the vaccine mandate comes down, and it will, they will know Abington will not blindly comply. Thank you.
Would anyone else like to speak? Come on up. State your name and address, please.
My name is Rick Collins. I'm 74 Orange Street, and I am the blogger that was attacked by the chairwoman of the school committee a few moments ago. And I am very disappointed that the chair of the school committee in Abington would take so much time at the start of a public meeting to criticize and attack someone in this community personally and directly, especially when what they do is volunteer their time and money to run a site to help keep the people of this town informed. I don't make money off this. In fact, I pay to run this site. And all I'm doing this for is so people have a better understanding of what's going on in our community. And I spend considerable time away from my family, my other activities I'd rather be doing, but I do this because I think it helps the town. And I just want to read something, a comment that the chairwoman sent me publicly. It says, "Hello, good article, Rick, to the point and exactly what I said, thank you." But apparently later on that afternoon, it wasn't good anymore, and I think that's after people decided that they didn't agree with what was said. So I don't know what is happening. I don't want to be the focus here. I don't think I should be. I don't think the chairwoman of the school committee should be spending time attacking someone who's trying to run a site for the town. And I hope that this will move on to something more substantive.
Thank you. Just a rebuttal there, again, there was another sentence to what I sent you, what I wrote publicly, that wasn't included in your sentence here. Would anyone else like to speak? Come on up.
Sure, I'm not able to follow that very well, but I'll do my best. My name is Lisa Humphreys, and I live on Bedford Street, and I'm super nervous, but I'm going to tell my story. So the other day, my daughter became positive with COVID. No big deal. I had to go pick her up from school. At 9:20, I called the middle school nurse to let her know and give her a courtesy call and let her know that my daughter came up positive on an antigen test at her school because she came in close contact. She was not available, so I left a message with the school secretary. The school secretary took that information and before anyone directly spoke with me, just ran with it. I mean, I have like a timeline here. I don't even know if I should say it all, but I think maybe if people can follow it, it will be beneficial. So at 9:44, Mrs. Smith calls me, and I was in the middle of picking my daughter up because that's the first child I went to because she became positive. So I went to go pick her up at school. I wasn't able to answer the phone because I was in the middle of doing that. Nurse Smith did leave me a message saying that I need to pick up my son right away and to give her a call. At 9:47, before I could even return her call, which I think was 3 minutes later, my phone began to ring, and it was my son calling me from his cell phone. My son is 12 years old. My son got on the phone and was extremely upset. His voice was shaking, and all he could say was, "Mom, mom, mom." I don't know if everybody in here is a parent, but you know when your child's voice is shaking, and it's infuriating. My first response to him was, "Are you okay?" Because I deeply thought something was wrong with him. I don't have a record of the exact conversation, like the voicemail recording that I have, but I was told by Nurse Smith as she was yelling across the room because my son had me on speakerphone that I need to come pick my son up right away. I agreed and I said, I'm doing the best I can. I'm not sure how fast I'll be able to get there, but I'm working on it. She told me my son could not be in school until I talked to the Board of Health, and her voice was extremely frazzled and, like, I don't want to say agitated, but maybe just overwhelmed. Again, I had communicated to her, now I'm getting a little frustrated that I'll do the best I can and I'm getting there as fast as I can, but I have another child that I have to pick up as well. She told me again that I can't have my son at school until the Board of Health contacts me, and I said, well, if you could have the Board of Health contact me right away, because this seems pretty rash considering the circumstances. This is the first time I'm even speaking with her, and I'm just being told to come pick my son up. So at 9:56, the high school nurse calls me and basically just insensitively starts demanding information about how many bathrooms I have, how big my household is, who my son's come in contact with, who my daughter's come in contact with, like, just very not good bedside manner. At this point, I'm extremely frustrated because I'm trying to drive from one place to another so I can get my daughter and then take care of my son, who my son is clearly uncomfortable at school, which is supposed to be a safe place. At 11:10, at 10:11, I called the Abington School again to have my son start walking because Nurse LaPointe was very clear that I needed to get my son right away. And I did use some explicit or inexplicit language and said I didn't have a bleeping jet and I'm doing the best I can, because at this point now I'm frazzled and I have a nurse frazzled and another nurse calling me frantic over a positive COVID test of a child that's not even in the building with them. By 10:20, the Board of Health called me, Lindsay Wright, and determined quickly that my son should not have been denied his school day or removed because he's fully vaccinated. And because we have masks on, so we should be okay if we have a mask on. By 10:26, the nurse called me as I'm pulling out of school to tell me that I can bring my son back to school. Yeah. So by the time the dust had settled with, the two nurses frantic, calling me, upsetting my son, I asked my son what happened. And he said, and I quote, "First she threw me in a room and didn't tell me anything about why I was taken out of class and left me there." My son's 12. My son told me he was scared that something happened to me at work and that I was either hurt or dead. I'm in construction, so I could die any day. Anybody could die any day, but no child should wonder what's wrong with their parent and just be stuck in a room. He said that Mrs. Smith came back to the door and said to him, "What do you know about your sister having COVID?" My son knows nothing because he's been at school, She had my son use his personal phone to contact me, which alarmed him even more. She waited 3 minutes after leaving me a voicemail to do so. As I mentioned in the beginning, maybe I didn't, but all this is timestamped, so I didn't make these times up that I have documented. She really had no business telling my son that my daughter had COVID, or anybody for that matter. I don't think that's anyone's business. Now everybody knows, but she's fine, so it's okay. Everything that happened on that day from 9:44 until 11:01 was an hour and 28 minutes. My son was in a room for an hour and 28 minutes not knowing what was going on. He's 12. So he had to go back to school the next day, and obviously all his peers want to know why he was removed from the classroom. And when he tells them that his sister has COVID, what do you think the other children's reaction is when they see nurses running around and teachers running around and parents running around frantic because someone's sick? So now my son's a target at school. And it's just not right. And it's disappointing. And today I was told by another parent in town that this has happened more than once, because it happened again this week to a separate child. And that child was in fear of their mother and father, something happening. Well, we just leave these kids in limbo. And I don't know what the protocol is. It shouldn't be that. It's disappointing. Children are supposed to go to school and they're supposed to feel comfortable. They're supposed to feel safe. And if those things aren't happening and they have, you know, anxiety going to school, they're not going to learn to begin with. So what's the point of even them even being there? So, yeah, that's my story. I don't know if anyone really grasped it, but I mean, an hour and 28 minutes for a 12-year-old to be in a room, and he told me he was locked in the room. He probably wasn't locked in the room. But can you imagine being pulled out of work and somebody saying, "What do you know about your husband or wife?" and just being just being left there? I mean, it's just not right, and it shouldn't be happening, and it's continuing to happen. And the nurses shouldn't be handling it like that. I don't know what can be changed, but something needs to change, because it's just, that wasn't fair to my child, most of all, but also the anxiety of having a parent try to rush from one child to another. Like, it's just creating more chaos, and it just doesn't need to be that way. So.
Thank you, Lisa.
So, if I could just for a second, Ms. Humphries, the way you related that story. Mrs. Humphries, thank you. The way you related that story isn't the experience anyone wants any child to have in Abington. Joan Smith isn't here to publicly defend herself or her actions, or really are the other nurses at this point. The Joan Smith I know is probably the kindest, most compassionate person I've ever met, probably on the planet, but definitely in Abington. And I know that she would not want your son to have a negative experience in her care. And so if this is something that, you know, you want me to review with you, with her, with the school, I'll do that. Because again, she's not here to speak to it, and what you related is not what we would want to have happen.
Correct.
Wendy, can I just ask something? So,
Of course.
my first wrote down, I don't know if it was discussed with Mr. McCurtain or Mr. Schaefer. I'm guessing not, based on at least Peter not knowing about it. But if we can just, we're not supposed to allow accusations unless the person's here gives proper notice to be here to defend themselves. So we can just have people stop, if you can stop you from accusing anybody of anything.
Yes.
That would be better off. Thank you.
Definitely. You're right. Also, too, Desi put out guidance that I think I sent to everybody a couple of weeks ago that we don't have to have a separate room, technically, for kids, like, that each school could do it as they please, but I don't know if everybody read it, so that's just something to consider.
And I don't know exactly what the condition was at the time.
No, I know, I'm just
Yeah.
saying for future,
Yeah.
like, maybe
Yeah.
we can find a different avenue. Thank you, everybody. Anyone else like to speak? Okay. If no, go ahead.
I am also very nervous. I'm not used to speaking, so bear with me. My name is Nicole Emery. I live at 16 Pond Street. I'm a mother to 4 children. I'm also a nurse. I work inpatient at a large Boston hospital. I'm no stranger to COVID, constantly changing COVID protocols. And working in oncology, I'm no stranger to how various testing and PPE/masks work. I'll apologize if anything I'm briefly about to talk about has been brought up before. I just had a baby, 8 weeks postpartum, so I've kind of missed a lot of things that have happened recently. So if I'm repeating anything, I apologize. I wanted to come up here just to ask everyone sitting up here what you guys are doing to push back on the DESE overreach. You all made a decision that we would not make masks mandatory. Commissioner Riley basically had a tantrum that too many districts were making decisions for themselves and decided to take that authority away from you. DESE then gave goals and guidance on when masks could start to be removed, and to no surprise, the goal and guidance has changed. Much like everything else we've experienced over this last year, they keep moving the goalpost. So what are you doing for us? Are you questioning any of this? Calling, emailing, writing letters? Are we pushing back at all? Are we questioning and just going along with whatever DESE determines is best for us and for who knows how long? Are any of you looking into these protocols that they've established to see if relying on them to make safe and educated health policy decisions for our kids, are they safe? We know they get most of their guidance from the CDC. However, the CDC themselves have changed their guidance and policies more times than I could ever keep track of, and even the hospital acknowledged us. We would go into work, and we would have to have a debrief about what changed that day, because it changed every day. I do not understand why we're subjecting our kids, a low-risk population, to some of these things. Masks being an obvious thing, another being the serial testing of asymptomatic kids. I know pool testing was another option they gave us, but why are we forcing asymptomatic kids to do any of this? We should be pushing back and questioning. DESE used a study done in England to support their test and stay protocol. It stated in the DESE DPH protocols for responding to COVID-19 scenarios, school year 2021 to 2022, if schools choose not to participate in the statewide COVID-19 testing program and do not participate in a similar testing initiative, unvaccinated individuals must follow the traditional quarantine protocol. So kids would need to quarantine for, I think it's 7 to 10 days, miss school for 7 to 10 days if they don't comply with this testing program. This testing program was decided based on a study called A Cluster Randomized Trial of Impact of a Policy of Daily Testing for Contacts of COVID-19 Cases on Attendance and COVID-19 Transmission in English Secondary Schools and Colleges. If you were to look at this article and research it, you would find bolded, underlined, italicized. This article is a preprint, it has not been peer-reviewed. It reports new medical research that has yet to be evaluated and should not being italicized, be used to guide clinical practice. I checked it today, it still says that. DESE is telling us we must choose one of these testing programs or else asymptomatic unvaccinated kids must quarantine and miss school, but basing it off a study that clearly says it should not be used for clinical guidance. So what other protocols and decisions have been made when no one's paying attention? Masking is another one. I know everyone's seen both sides of the mask debate. You've seen the studies they want you to see. I'm telling you, none of this makes sense. I work in oncology. I work with some of those immunocompromised, vulnerable patients that there are. None of this makes sense. There are lots of doctors and nurses that feel the same way, and they would tell you when they're not being basically silenced and muted. We want our kids out of masks. They step out of school, there's no masks, weekends, no masks, birthday parties, concerts, you get the point, no masks. As a parent and a nurse, I'm asking you to look into what's being done. Look into the testing, look into the masking, and start asking questions. Use your position to push back. We put you in these seats to ask questions, use your voice, not to be wishy-washy. Push back, please. I'll end with this. Commissioner Rowley used his authority to mandate these masks off of the board's responsibility to, quote, establish standards to ensure that every student shall attend classes in a safe environment. This is according to General Laws, Part 1, Title 12, Chapter 69, Section 1B. It does not define safe environment, and I would suggest to everyone here that we define it. Because to me, as a nurse, a safe environment would not include my 7-year-old being in a secretion-soaked mask for 6 hours a day, worrying if she takes it off, if she'll get the sickness, and if it's going to kill us all. So I'll end with my question again. What are you all doing for us? I know there's a letter Wendy has proposed we send to DESE, and I would strongly urge you, as a nurse, as a mother, that you please send it. That's it. I'm done.
Can I ask a question? Of course.
Do you have the article? Would you be willing to send me a copy of it?
Yes, it's actually right on the DESE website.
It is on the DESE
It's
website.
in their COVID-19 guidelines. It's in like the footnote, the studies they used.
Sure.
Most of the studies are not peer reviewed, don't apply, their adult populations don't apply to this population. But yeah, I could definitely send it to you as well, but it's directly from their website too.
Because to your point, the goalpost comment is dead accurate.
Yes.
I fully understand this is one of those things that till now, till later. So I
always
definitely
changing.
get that, but I'm very curious to look at that. So thank you.
Yep.
Thank you. Would anyone else like to speak? If you could just state your name and address, please.
I'm not a professional speaker either, so. I'm David Kelly, 1248 Washington Street, Abington. Thanks, Mr. Schaefer. You've helped me out with a couple of things in the past. I want to say thank you to you. A couple other things that I don't talk about right now, but. So I emailed the board, I emailed Mr. Schaefer August 11th before DESE made their announcement. And I just want to talk about, real quick, my emails. Basically, what I was trying to get at with this email was if anybody had any data regarding children 5 to 17. And found out nobody knew anything. Symptoms, hospitalizations, deaths. I was told by Mrs. Groom to reach out to the Board of Health, and which I did, and they didn't have any information either, so. We're making a lot of decisions here, masks, vaccines potentially, testing, but nobody knows who's sick, where they are, if they're in the hospital. I'm in a position to say, I don't think there's that many cases. Maybe someone can correct me and tell me, because what I could see, there was really, I'm not gonna read all these emails, but I did forward Mr. Schaefer an article from Dr. Mackery, and it goes into how no money has been spent on the research for masks on children. Despite all the money they spent, there's been no studies. And in that email, it was attached, it discusses the CDC a lot. And a portion of my emails makes a comment about unelected officials. And I was referring to the CDC and the NIH. But the response I got from Mr. Coyle was, I'm referring to us, meaning the board. So instead of getting an answer from him for the question I was asking, I got an email saying, do you know who I am? We need to be a little bit more humble. We're all in the same town. We all send our kids to the same schools. We need to take a step back. And nobody's better than anybody else. So that kind of ticked me off a little bit. So again, nobody seems to know any data in this town. And that's a shame, because all I was asking for was, I was told to check the state's website, which breaks down how many people in Abington have tested positive for COVID. It doesn't say how many children have tested positive, but I was continuously given that link to check that link. I was continuously saying that the information I was looking for wasn't on there, so. If anybody can come up with some data, I'm sure there's a lot of people in this room who would like to know who's getting, if there are any kids that are, I know kids they test positive. We get an email once a week now, which is a lot better than every day, which it was last year. But when last June ended, I thought this was all done, when the school year ended. I didn't know we were gonna be sitting here tonight talking about it in September, starting a new school year, but here we are. So I'm asking to if we can do anything, same with what the nurse said, I can't follow up with her, but she knows a lot more than I do, but, we need to figure out if we can do anything, and get rid of these masks, make them optional. If a parent wants to send their kid to school with a mask, you can wear a mask. I don't think it should be mandatory anymore. I think this is been on long enough, and that's all I want to say.
Mr. Kelly, I'm sorry you took it that way.
Yeah.
Anybody I think who knows me, has dealt with me, knows I don't feel that way about myself. I remember replying that to you. That wasn't my thinking when I wrote it back. I'm sorry you took it that way.
What I was trying to get at was just some answers. And
But I don't have, I'm not a medical
That was
expert.
the whole point of me getting up there, was telling everybody here that you guys don't have any answers.
Correct, we're not medical experts.
But you're making decisions.
No, we're not.
Well, prior to the state making a mandate,
Yes.
were you about to vote on a mask mandate?
No, we were not. We were gonna follow the state's guidance of strongly recommending masks be worn.
Last I heard was that Governor Baker was leaving it up to the towns to decide if there was gonna be a mask mandate.
Correct,
Am I wrong?
and yeah, no, you're not. And Superintendent Schaefer sent out a letter from himself and the school committee stating that our intention was to stick with the DESI guidance, which was strongly recommending masks be worn,
Okay.
but not requiring. That's where we stood. We've
Right.
never made a decision on this.
So
The
now
state
you understand
then,
what I mean by unelected officials then, right? Because
Well,
If you're following the CDC.
no, we're
I-
following
I'm
the
a
department,
business
we're
employee.
following the Department of Elementary and Secondary Education. We have no choice in that matter to follow them.
But they made their announcement at the end of July, right? I mean, the end of August.
Correct, August
What was,
25th.
what was going on with the board prior to that?
With
I work
our
a 3 to
board?
11 shift, I don't come to these meetings that often.
With our board, I mean, Wendy, I'll let you answer
Right.
this.
We sent a letter. Well, we came together as a board. We actually explained this at the 8:25 meeting. I forget what date it was, of how it all went down. So we did come together as a board and decide that we were just going to follow the DESI mask. It's optional, it's recommended, but you don't have to wear a mask if you don't want to.
Okay, so
So
it would have been
that,
optional until he changed it.
correct,
Correct.
correct. Yep, it would have been optional until he changed
So
it.
my whole point of reaching out the first time was just to put my input in.
Sure.
If there was a vote,
Correct.
ask you guys to consider making the mask optional, that's
Yeah.
all. I was
Yeah, and if
saying.
we had a vote, we would have considered, but we never had a vote on the topic.
Right, we decided that it just, like with everything going on and people were away and things were just happening and we all kind of came together, you know, everyone was given a choice of kind of how like they wanted to go about it and the majority was to send a letter. And so that's what we ended up doing.
May I?
Of course.
Yeah.
Mr. Kelly, I think part of the confusion, and I don't know where it came from, but we had agreed to send out the letter. We have a history of following DESI mandates, so we put out the letter to say that we were going to let it be parent choice. Something happened between then and the mandate coming out that somehow the perception around town was that we were going to hold a meeting to change that. That was never anything that was actually going to happen. I'm not quite sure where the perception came from. I was receiving emails saying, why are you changing your mind? And I thought, well, I'm really not. I never. And so I think a lot of us were disappointed when the mandate did come down because we wanted to give families the options. I wanted to give teachers the option to be able to read aloud to kids without a mask on. And the problem is, that option was taken away from us, which means it was taken away from the community as well. Yes, I'm sitting here in a mask. I've worked outside of the country in places where I have watched masks work as far as flu epidemics, things like that. So I may be right, I might be wrong. I'm not a medical health professional, but I'm just trying to do my next right thing, as are you. But I can see where the confusion is. There was a lot of misinformation out there, and I don't think anybody really wanted this to go down the way it did.
I understand. But a couple people already spoke up tonight and said, they're asking you as a board if you're gonna do anything further, if you're just gonna sit back and let this go on month after month and have them extended another month until the school year's over, and then we do it all over again next year. Because I'm telling you right now, maybe people don't do the same kind of research I do, but there's doctors out there now that are saying this is like the flu and it will maybe never go away. It's an endemic, not a pandemic. Just like the flu or the common cold, it's a virus. So, like, again, how long does it go on for? It's an 8-hour, 7-hour day, and I could take a bus for another hour, so take away the mask on the bus. I mean, it's.
I get it. I think we're all exhausted. I think we're all ready for this to be done, and I don't disagree. The thing right now is, can we send a letter? Are they gonna?
Probably not gonna do anything, but I mean, it would be an attempt.
Your feedback is valuable. I want you to know that, and yeah, the moving of the goalposts is definitely. It's frustrating, for sure.
I get it, you get vaccinated and kids wear masks, it's ridiculous. I got a 15-year-old that's fully vaccinated, and she has to wear a mask all day. So where does it end? And I thought the vaccine was supposed to stop the virus from,
I know.
And then she's high honors, she's doing, I got 2 twins that are on IEP with delayed learning. They missed a bunch of school last year, and I'm trying to get caught up with them. And now, that's got nothing to do with the mask, but I'm just saying, they missed a lot of school last year. They had to do the remote learning, which I don't think is as good as in-person learning. So, I get a lot going on in my house, so, I mean, we all do, that's why we're here tonight.
Thank you for being here.
And Miss Emerson read off an article from a study that you say she came from Desi, but
Will you come up here? I'm sorry.
I'll just let someone
Oh.
speak.
It's not that bad, get up there.
I had like a sentence to say.
A sentence is good. If you want to,
We like sentences.
I'll let someone else speak.
okay, go ahead.
My name is Andrew King. I live at 493 Hancock Street. And in August, when the Department of Education came out saying that they were going to require masks, me and my wife started looking into trying to get my 8-year-old daughter a medical exemption. She has severe anxiety. She has tics. And when we told her we were going to look into that, she threw a tantrum and begged us not to make her an outcast in the school. And I just don't think it's fair that they put us in the position of choosing between my child's physical health and my child's mental health. Please sign this petition and send it to the state and give us parents the choice back.
Thank you. Would anyone else like to speak?
I will.
Hi, my name is Christina Cool. I live on Plymouth Street in Abington. Can you hear me?
Yes.
Can you hear me? Okay. I have 4 young children at home who 2 currently right now are in the Abington Public Schools. I have 2 little ones who will keep going, they'll go through the schools. The mask mandates and these other ridiculous COVID restrictions that have been implemented in the public schools, it needs to stop. Like, I just feel like you need to stop and think, is this rational? Is what we are doing rational? I know that maybe you have higher up people telling you what to do, but as a human being, as a parent, as a a friend, someone in the community, just think for yourself. Like, really, do you think these things make sense? So some of the reasons I believe there should not be, especially the kids, they're the least affected by COVID, but yet their lives are completely disrupted, and it's ridiculous. Like, this needs to stop. Children very rarely spread it to adults. They have very little risk to COVID. They have 99 point something percentage of recovery. The masks are impractical for a school setting. I worked in a school last year. I'm at a school this year, so I see it firsthand all day. I see the craziness with the masks, and the kids just are not mature enough to wear them appropriately. And I mean, we have to be honest there. It's ineffective because they're not wearing them right. So, perfect example, I had a child today who said, "Miss Cool, can I change my mask?" He literally handed it to me, and it was sopping wet. I don't mean just a little wet. I mean sopping wet. Then I had another student who's like, "Can I use the restroom?" And I looked over, he had a paper mask. Literally, there was a hole in the mask because it was wet. He didn't even know. He doesn't even care. He's like, and I'm looking at him, and it's ripped. Okay, so these things don't make sense. It'd be one thing if they were wearing it appropriately, but this is a big waste of time because they're not. Okay, they're not sanitary. The kids are, they're all sorts of stuff. So they're supposed to be changed all the time. They're not changed all the time. I mean, honestly, I hang mine on my rearview mirror because, I feel strongly you need to live your life. You need to move on. This has been over 1.5 years, and we need to stand up. Like, this needs to end because the next thing will be vaccinating the kids. It has to stop. Even on the boxes of the masks, I don't know if you've seen, I did buy one, I forgot it today. It says right on it, this does not prevent from virus. It literally just says it right on there. And we're still enforcing this. This makes no sense. For their social and emotional well-being, it disrupts communication. It's awful for the kids on the IEP. It's not fair. They have bigger fish to fry than someone going, cover your nose. Cover your nose. Put your mask on, Johnny. You know what? They have bigger fish to fry. And so don't a lot of our other kids who aren't on IEPs, okay? You know, the kids can't read facial expressions. Okay, perfect example. At the school I worked at, it was a beautiful day, 85 degrees. The kids had gym outside. So I just, you know, I just say, just want to remind you guys, you can take your mask off. 85 degrees. There was a little boy, wouldn't take his mask off. Literally, his hair's sopping wet. He's going to pass out because he's so scared. It's not okay. The other thing I've noticed, a lot of the kids will be like almost like a mask police and be like, oh, he doesn't have his mask on. He doesn't. And I just say, well, you know, you worry about you and, you know, whatever. Like, try to just kind of redirect their attention to themselves, right? But this is also happening with adults. So we may think that it's just, oh, the kids, you know, but it's also happening with adults. This summer, you know, I got to be honest, I was invited to a house to go to for the summer, but at that time I had not made a decision about getting vaccinated, and I was uninvited. But this is where this is going. So anyway, I just don't like that the kids are being taught to be afraid of one another. You know, I mean, when I was working at school last year, and I know people get scared. This is fear. This is all fear-driven, and it's propaganda. And I think people need to stop and think, what are we doing? So children, you know, someone falls down, you're teaching them, oh, don't help them. That's not human. It's human nature to go, oh my gosh, are you okay? And that's what I want my kids to do. I don't want them to be afraid of their friends. Like, enough is enough. So I am really asking you to figure out a way that we can at least have a choice. If your masks work, you're good to go. Your vaccine works, you're good to go. All set. You do you. You want to wear 7 masks? Wear 7 masks. I don't care. Because I want to live my life. I want everything to go back the way it was. And if we don't take a stand, this is going to continue, and that's going to be the vaccines that are untested. And why would I give my 4 beautiful, healthy children, vibrant, healthy children who have a 99.9% rate of, a rate of recovery, an untested vaccine for COVID-19 that doesn't even affect their age groups? So why would I do that? Why are we going to force children to have it? It just doesn't make sense. So anyway, I am just asking you, people, this one more thing. People will say, it's just a mask. They're like, it doesn't bother me, it's just a mask. And okay, it's just a mask, but think back to our childhood, and when we were in school, what did we worry about? Who's gonna play Foursquare, or who's doing this, and who's doing that, and whatever, you're a little kid playing with Cabbage Patch dolls, right? Because right? And those are the things that they should be worried about, not a virus. I mean, the fear is insane, and I want to speak out for my kids because I want them to go to school maskless and have all the wonderful memories that I had. And if we don't stop, this is gonna keep going. Like, and I'm scared. I'm scared for the country, I'm scared for our future, and it needs to stop. So we need to speak out for them because we know better. People say, oh, the kids had fun. They don't even care they're wearing a mask. But we know better. We remember our childhood. So I'm sorry I'm getting upset, but I'm very tired of being a mouse. I'm tired of it. And I know in my heart of hearts that this has to stop. And you need to take a stand. Not as, just say, oh, I'm told to do this. Like, enough. All right, I'm sorry, I'm just getting upset, but because this is just getting really out of control at this point. Yeah.
Would anyone else like to speak?
I'm not a good speaker, but I just can't do it.
I didn't come prepared, but she moved me. My name's Leah. I live on Walnut Street in Abington. My kids are in pre-K and first grade. So when the mask mandates came out and Desi had said that we'll, have parents' choice, I thought that's great. I can do what I want for my kids because that's what's best for my kids. And then when Desi came out and said, no, we're going to start to mandate these masks, I decided that that's not what's best for my kids. Last year, my son was in a mask all day, and he would come home afraid. And he had really bad anxiety and going out. I remember before COVID, the teacher always said my son was the hugger. He would hug everyone that came to school, and they had to crush that out of him due to COVID because they didn't want him touching anyone. He would fall, or my daughter would fall, and nobody would console them. They're not getting touched anymore, and that's what teachers of pre-K and kindergarten should be doing, is helping, not making them afraid of people. So I pulled my kids from Abington. I still come here because this is my town and I want to stand behind my town, but I pulled my kids out of Abington Public Schools because I don't believe that you guys and what we're doing is right. I think that giving parents the choice is what's right. I have them enrolled in a school where masks are optional. If you want to wear a mask or you want your kids to wear a mask, great, and if not, you don't have to. I haven't heard of any COVID outbreaks. They said they didn't have any last year, and they followed the same protocols. They have story time on rugs, and the teachers, if somebody falls, gives them a Band-Aid and gives them a hug and helps them up. So I just think I agree. We need to stand up, and we need to do what's right for our kids. That's all I have to say.
Would anyone else like to speak? You can just state your name and address.
On a PV 501 Summer Street. I'm sorry. I think you guys all have your own choice, and I really do. But our teachers, and I work at the schools, and I've worked at the schools, our teachers do care for our kids. And I work out in the recess, and I work out there. Those kindergarten teachers do love your kids. They put Band-Aids on them, and they do care for them. And I know it's hard, because I have an autistic child who I'm scared to death that I sent up to the middle school for the first time. I don't know anybody up there. I've got her in a mask, too. I know these teachers are taking care of them. I see these teachers, I'm watching these teachers. They take care of those kids, and they give those kids the love and the care they need. I go into these indoor recess today. They're on the rugs, and they're there. The teachers care for them, and they're talking to them, and they're reading to them, and they're doing everything they can for your kids, too. I hate my mask, but I'm not taking it off because I'm afraid of my 10-year-old daughter who has autism. Because if she does get it, and then I have to give her a vaccine, I don't know what causes autism, and I don't know what the hell that vaccine,
It's okay.
what that vaccine's going to do to her. But I know it's emotional and everything, but I don't want our teachers looking bad either, because these teachers care for those kids, and they do everything in their power to take care of those kids and be there as close as they can with them. And there's those kids, and they're not the mask. Everyone keeps saying 6 hours, 6 hours. They do have mask breaks. They do go outside and take them off. They do change them because I change them. I hand them to those kids going back in sometimes too. If they look, but wait, let me finish, please. I know you got emotional. I am too, because these teachers, the teachers do, and I've seen the teachers hand them to them too. Some of the kids are messy. My daughter does this all day long to her mask. I probably pack 5 of them in her backpack because she does this, and they do get dirty. I probably wash mine 6 times a day. And it is awful, and some people, you should have your own choice. I understand that. But our teachers are awesome, and they work their butts off to take care of those kids and do the best they can to be with them. So please don't feel like they're not getting their Band-Aids and their care that they need, because I do watch it every day that I go in there, and I'm with the younger kids, and I see that. So I just want you all to make sure that you do know how hard our teachers work, because they do really, really do. Thank you.
Would anyone else like to speak? I think we will move on to our regular agenda items. Thank you, everyone, for speaking tonight. So we have the reading and approval of records. We have our September 1st meeting and our August 25th meeting. If everybody could just go through them both, and I'll just try to, we can do a recommended action on both of them just to speed it up a little.
You want me to do both?
If that's okay, if we could do both at the same time.
Yep.
And when you're ready, if I could get a motion to approve the September 1st, 2021 and the August 25th, 2021 meeting minutes. Excuse me.
Make a motion.
I'll second.
All in favor?
Aye.
Aye. Thank you. So next on the agenda is unfinished business. So there's just an FYI. So there's kind of two parts to this. One is a proposed letter that that I had brought to the committee last meeting, and it was voted to hold off until this meeting to discuss further. The second part, I just want to be clear. The second part of this is entirely different. So the second part is a Silver Lake Regional District letter that was sent to DESE, as well as a Sandwich Public Schools letter that was sent to DESE. And I know of other towns as well, and I was told what they were last night, and I completely forget what they were, that have also sent emails to DESE. So if one doesn't work, I was just gonna see if, maybe the second one would, and just see where we can go from there. The second one, I was hoping that we could come together and take parts of Silver Lake and Sandwich, not tonight, but just to say that we could take parts from it and all come together to decide what are the best parts that we should use and then send it to DESE. So there's kind of two ways. So if we could go over the first one, this is a proposed letter that I actually took from Hanover, and we adjusted it so that it fits Abington, and I'm hoping that we would, that I would get an approval to send this. And what it says is the Abington School Committee urges DESE and Governor Baker to restore school COVID mitigation efforts, including mask requirements to local control on or before October 1st, so that will change now that we have another new mandate. As grounds, therefore, we state that local governance is in the best position to assess individual community needs and consider unique community resources that impact the risk of COVID transmission in our schools. We have implemented a best practice COVID testing program, contact tracing, and we have invested considerable financial resources into improving our air circulation in some of our school buildings. We strongly believe that local governance, including our school committee, can determine the best approach to COVID mitigation in our community while meeting the needs of families and keeping our community safe. So if I could just go first as to the reasons why I think we should send it, and then we can everybody else can have a chance to talk about it. So based on the numbers that I've asked Peter to provide every week, and he's already been doing it with the town, I feel like that our numbers for our school system is very low. The AEA, the early education program, they have not had any COVID instances as far as I know. And they are masked and not masked, some of those students. And we've had very few instances. I think as of yesterday when you gave me the numbers, there were 5 total in the whole district. I believe one of our schools didn't have any.
So, as of the 24th, reported on the 27th, for the entire year, we've had 24 in total.
In total. And last week, how many did we have? It was,
I want to say it was like 6.
yeah,
I don't
5 or
remember
6.
exactly.
I know there were 2 schools that didn't have any issues at all. Nobody had
In
COVID.
total for the year, 0 at the AEP, the pre-K, 8 at the Beaverbrook, 4 at the Woodsdale, 6 at the middle school, and 6 at the high school.
Thank you.
That's since the opening.
Since the opening. So I feel like that everything that's happening right now, I know that there's, I have some issues with the Binex Now tests that, I've just received kind of conflicting information about that. But I'm willing, if we can, just to send this to Governor Baker and to DESE to let them know that we have our eye on them, that we are keeping up with our protocols, and the numbers here are low, and the kids at lunch, they're still separated, and they're at least 3 feet apart. At lunch, there's contact tracing in case anything happens with that. Right now, with the push to extend the masks, I don't know the real reason that Desi is doing this. Like, they didn't, to me, from what I gathered, they didn't say anything. I know that Felicia was on a meeting with Desi when he extended it, and as far as I know, the meeting lasted less than 5 minutes, and Commissioner Riley took absolutely no questions. So, I mean, for school districts not to be able to come to the person and ask them, you know, anything, I just think is kind of a bad thing. Like, everybody should be able to talk to the person that's in charge of, you know, all of our kids. I think that the idea of masking, for me and my family, isn't a good one. Like, my daughter's 15, you know, she's compliant. She will do what she's told, with everybody else except for me, but she has pimples, like right here. You can see them right here, exactly where the mask would be. She sent me a picture. I will totally show it to everybody. Yesterday she takes like oil sheets, I don't know, some sort of strips, and she brings them to school, so that when she needs, like, when she gets a mask break or gets a break at all, she just kind of cleans her face, since the mask is always on there. And the oil and grossness that comes off, I mean, my kid is super clean. Like, and the stuff that comes off of the oil, like, I have pictures, you guys can see them, they're just not pretty at all. And I just hear that a lot of children, I know that people say that it's okay, they're compliant, but they're compliant because they're in school. They're being told what to do. If they're outside of school, nobody has a mask on. They're all playing together, they're hugging, they're, you know, wrestling, they're going and having sleepovers and everything. It's just that when they get into school, it's different. And I know that there are issues with lots of different people. I know that there are immune compromised kids. I know that there are people that, you know, don't want a mask or don't feel comfortable. But that's why I really think that we need to open this up and offer a remote setting for it. And I'm not saying to, like, exclude anyone, but just giving people the option. Everyone here, we live in America, we should have options. And if, you know, you guys are wearing a mask next to me, that's great. Maybe I'll go someplace one day and I'll be like, this looks scary, and I'll put a mask on. I don't know. We'll have to see how it goes, but I doubt it. So I just want our kids to be able to breathe. I want them to be able to see each other. I want them to be able to, you know, read expressions. And, you know, I feel bad for the teachers that are trying to teach young children that may have issues speaking or hearing, you know, being able to see faces and, you know, trying to pronounce words. We've all heard this over, you know, the past year. It's the same thing over and over. And I really feel like our kids are falling behind. You know, I mean, what is Desi going to come up with in 5 years for the effect of, you know, our kids just not being in the educational place that they should be in? There are other countries right now that have totally decimated and took away masks, and they, I think it was the Netherlands, and everybody seems to be fine. Down in Florida, they say that, you know, everything's overrun with kids being in the hospitals, but I'm hearing different stuff from actual people. The media, I think, tells you a different story. So I read a story that for how many ever, like, deaths there were from people getting COVID, only 6% were actually from COVID. Everyone else had an underlying disease. So, or, you know, maybe they were older, but there was something else wrong with them first. It wasn't just like they went into a room. There was something, cancer, you know, whatever it could be, that there are definite reasons why they had passed away. I know people that work at South Shore Hospital. There are over 400 beds. They are not inundated with COVID patients. These patients, if they do have COVID, they have other illnesses as well. And, you know, so there are still open beds. I know that, like, you go to the emergency room, it's crazy, but that's everywhere. So I just think that I have data as well, actually. And this one's really important. So just to give everybody some background. So because of everything that's going on, I've been trying to do research. I know I'm not a scientist and everything, but just there is data out there. Felicia put me in touch with Miss Wu, who works at DESE. She is the director of strategic transformation. And we were talking about the Binex Now test, and she kind of gave like a canned statement to me, and I wasn't super satisfied with it. So she put me in touch with two individuals. One is Dr. Small, and the other is Dr. Madoff. And one is like, big time lab person, science, working at the DPH. I can give you all an email. I don't have it right now. I can give you all like their background and their status of who they are. Tomorrow or tonight or something, I can email you. I'm sorry, I don't have that. So anyway, one of these doctors who said that we should mandate masks, her name is Dr. Small, and she was part of a study the study is transmission of severe acute respiratory syndrome, coronavirus 2, from asymptomatic and pre-symptomatic individuals in healthcare settings despite medical mask and eye protection. So I'm not going to read all of this, but I just want to give you the headline of each thing. So there were 3 cases that they studied. The first case was transmission from an asymptomatic unmasked patient to 2 patient care assistants wearing masks and face shields. The second case was transmission from a pre-symptomatic masked nurse to an unmasked patient. And the third case was a transmission from a pre-symptomatic masked patient to an ambulatory provider wearing a mask and goggles. All 3 of these cases, the people got COVID. They were masked. There were 2 people masked, 1 person masked, they got COVID. So, this is the person, Dr. Small, that's telling us to mask our kids and doing a study saying masks don't work unless you use, as she says here, they have to come up with better masks, like FDA approved masks, or make better masks with better, handling around the ears and everything. So that's her proposal in this for the discussion. I do have a copy for everybody here that I can give you if you don't mind passing that down. Thank you. Also, as you all are probably aware, nowadays, just within the last few days, more information has been coming out. Has anybody heard of RSV? It's a respiratory syncytial virus. So, I never heard of this before. I don't know. I might live under a rock, but I'm pretty worried that this is, it says, a viral illness that causes symptoms such as trouble breathing. It's most common cause of inflammation of the small airways in the lungs. So what studies are going to come out next saying that masking our kids gives them RSV or some other kind of, underlying disease from not being able to breathe correctly? So there was also another article from Dr. Madoff, who is another person that DESE refers to hand down mandates, I guess, to us. And Dr. Madoff, it's kind of a little bit different, but he was talking about the difference between antigen tests and the PCR tests, in saying that antigen tests aren't as good or powerful or reliable as PCR tests. There's a Binex Now, just so that everybody's aware. This really doesn't have anything to do with anything, but I just want parents to be aware. The Binex Now tests are what we're using. We brought it up before that we have expired tests. And, it was a 6-month date from what I understand, from what I read. The antigen tests usually go for about 9 months. Well, now they're saying that the Binex Now tests are okay to use for 12 months. So I've had a hysterectomy, so I'm not getting pregnant, but if I were questioning and wanted to get a pregnancy test, would I take one that is expired? I doubt it. I doubt any of us women would. So,
Can I just
yeah.
say, so the information that we did get from the person you cited at the beginning was that these tests are appropriate for us to
I'm
use.
getting that.
You don't feel as though you've gotten a satisfactory answer from them, but I just don't want people to think that we're.
No, I'm
doing-
getting there. I'm not.
Also,
I'm
if I
not done
could
yet.
say, Wendy, just in the interest of time, the letter is about masking, not about the testing. Can
Okay,
we
that's
maybe
fine.
kind of
Sure,
let others
we can
speak
bring that up
to
at another time. That's a good point, no problem.
Can I say something?
Sure.
Dude, no.
Yeah, if you could go up there.
That
Is
one.
it about the masking and,
It is, but
oh,
I thought we
Close the public
closed
comment
open.
on that.
I know,
Can we have comments from the board now?
we have done,
About
yeah,
this,
sure,
about this?
if you want,
it's just
like,
yeah,
a
I
quick, I mean, over the summer we had softball with my daughter and Chris Coyle was there. I mean, he was wearing his mask, I was wearing mine, and we all got along. Nobody got sick, nobody died. Like, I mean, Chris didn't have a problem then with me not wearing a mask. And then eventually my daughter asked me if she could take off her mask, and the team like went down the row with, hey, can I take my mask off? We got this one mask here, and then we got the cage mask over that. It's just getting ridiculous, and I mean, I'd like to get this through this with the town, and I mean, come together as a whole rather than try to fight with each other and pick apart each other. It's just getting crazy.
Thank you.
Wendy, if
Appreciate
I
that.
can, since I mentioned again.
Thank you, Wendy.
Danny, so you're right, we didn't. I don't run Abington girls softball, so
Right.
that's not my
Right.
decision to comment about anything. I just want to let that be known.
Okay, so without the Binex now, we can leave Dr. Matt off to another side. Oh, thank you. I completely forget where I was, so if you would like, or anybody would like to speak, then I can go back if you'd like. Do you want to talk first,
I
Julie?
would. I appreciate what everybody here has to say. You're all definitely very passionate about your feelings. And I would encourage all of you to continue meeting as a group. I know that's been happening. I would encourage you to continue, if you have been, or to start writing letters to DESE, Commissioner Riley, Governor Baker, your representatives. If you'd like to keep sending emails to the school board, that's great. We read all of them. But I do have to say that, for all the people that are commenting here, I'm getting just as many emails and comments from people who do not want us to be lifting or to be encouraging DESE to change their policy. I feel as a member of the school board, as many of you pointed out, we're elected officials, we work for you. I do not feel comfortable writing a letter or having my name attached to a letter that advocates for either side of this argument. Because, unfortunately, the people who want their kids to remain masked and are in support of the DESE guideline are not here for various reasons. There's not very much space, they didn't feel comfortable, but we are hearing from them as well, even though they're not as vocal. So for me, can I speak? Thank you. So that is my opinion. I'm not stating what side I fall on. I'm sure many of you know already, but that isn't the point of my statement. My statement is that I don't feel comfortable advocating for either side because I don't think that that's fair.
Isn't that the point of you being up there, though?
Yes, but I am hearing equally from both sides about their feelings. So I feel like I'm being disingenuous if I advocate only for the group that spoke here when there's just as many parents who would like to be advocated for. Now, I'd like to just point out, I happen to have a brother-in-law who is a mathematical modeler for infectious diseases in the Netherlands. They have an 82% vaccine rate. That's why they're able to get rid of masks. We're nowhere close to that here. So I just wanted to point that out.
Oh, that's good info.
Mhm.
Well,
So I think everyone wants the opportunity to speak.
do you mind waiting until, thank you. Danielle, do you have anything to say?
Not at this moment.
Okay. Heidi?
I'm deferring to Chris for now.
Sure.
Yeah, no, I'll speak, no problem. So, Danny, your statement about can't find a way to get along with it all, I completely agree with you. I'm gonna read some of it from the minutes because I'm gonna repeat some of the stuff that I said last time. But to start, so I said earlier, I'm not a medical expert, never claimed to be. I know I can find facts to support any argument I want to make on either side of this. The internet's a wonderful place. Everybody can find anything they want. There's no dispute. I can look up facts on either side and well, that'll claim to be facts. Let me put it to you that way. Anyone can catch COVID, masks or not. No disputing that with you either. I think the constant struggle that keeps on happening here, and this happened last time, and this is why I said, and it's happening right this minute. Nowhere on our agenda does it say to remove masks. We're asking for a letter. What's on the agenda is a letter to the DESE and the governor asking the decision to be put back to local school boards. However, everything I see in here, online, in my emails from both sides, so please don't take offense to anybody, is that nobody is okay with us making this decision. They're only okay with us making their decision. And that is part of the reason why DESE took this out of our hands to begin with. They didn't want the heat coming down on volunteers and local communities affecting their neighbors. If we all have to make a choice, I will make a decision. However, at this point, Wendy, I still don't feel, and if it's put up a motion, I will vote on the letter. But I'm letting you know right now, I don't feel comfortable, based on everything I've heard everywhere, that anybody in this community is really wants us to make the decision, wants us to make a decision that they don't agree with and would be okay with that. I'm not getting that feeling on either side. That said, I've read through the packet. The letter from Sandwich, I'm 100% behind. Something to that effect, I'm 100% behind. So that's on the whole block of ABC. So
I appreciate it.
thank you.
Okay, so I'm gonna leave one more. I'm gonna just go one more because it's really not fair because we did have a hearing of visitors. So, I mean, just because I know you're a nurse right? You're a nurse? Okay, that's the only reason why I just, I'll let you, I would let any of our nurses, talk. So is that okay? Can you make it I don't mean to.
It's just a time.
Okay, go ahead.
Mary Deshawn, 60 Patterson Street. The whole point of sending a letter to DESE is not to make decisions for anyone else except for your own self. So sending the letter to DESE is telling DESE not to make the decision for anybody else. The parents should be making the decisions for the children. That's the whole point. So it's not this side against that side. It's parents making the decisions for their child's health. That's it. It's very simple, and it's not a divisive thing. It's a come together as a town and say, we want what is best for our youth, and whatever that decision is individually, it's okay with everyone. Nobody here wants to make decisions for anybody else. Thank you.
Thank you.
DESE did allow us to make decisions for hybrid, remote, or.
But what I'm saying is, we can't send a letter. This letter does not state to ask us to take masks off kids. That's not what the letter you propose
Correct.
says. So that's
Correct.
all. And I just.
But I
feel like
just
my
wanted,
point's
because
constantly made, so.
you're totally right, and the reason why I'm bringing these things up is because I know that there are mixed emotions on the board. So I just wanted to let people know, the person that is handing down, making our kids masks is in black and white saying that the masks don't work. So that's the point that goes along with this letter that I wanted to make. So would anyone else like to speak?
So, I think I do. Sorry.
No,
Shocker,
don't be
really.
sorry.
So when we look at the Sandwich letter,
Can we talk about Sandwich after? Unless it refers to where you're at, just because it's a separate
it
issue?
absolutely refers to
Okay.
where I'm at. Because I am fine with the questioning of how are we coming to our conclusions, what are our timelines.
Right.
We are this close from having potential access to vaccines for our youngest school population. Now, that would open up for parents and children to make decisions for their families. At that point in time, then if people have choices on all sides, then I am more comfortable, because we do hear from all sides, and I feel deeply what the emotions in this room are. I cried along with you. I feel it. I understand it. I have kids. I live it too. I also have asked around. I polled a lot of people. I've also talked to a lot of people who have said, my kids are just thrilled to be in school. Not distance, hanging with their friends. The masks don't bother them. I get that that is not the case for every child, but it is the case for a lot of children. And for some families, us saying we want the control back. I don't want control. I don't want to be telling. But there are families out there who deeply feel that by us having the control to say you have the choice, for them that might mean that their child no longer has the choice of being protected, because maybe, I think you see what I'm saying. It is, so if we are this close to a point where people will have more options on both sides, something like the sandwich letter where we're questioning data and questioning timelines, I can stand behind. Asking for me to have the choice to tell everybody yes or no, that I'm not thrilled with.
I got you.
Okay.
And that's a really great point that you just made as well about, if we're already talking about like everybody, the ability to make choices, then the ability to make a vaccine choice should fall right in line.
To just follow up, I think if you ask me right now, truthfully, I think anybody 5 weeks removed from their 12th birthday, I'd probably be okay with them taking off their mask. But aside from that, without the ability of anybody else to get it if they want it, that's where it makes it tough.
I know, but it just makes it tough. Like, I understand.
And
what
also,
you guys
the
are
current
saying.
quarantine regulations that we have if we take masks off, quarantines would exponentially increase.
Education will be impacted for sure.
And that's what we have to think about as a school committee. Like, if right now with the mask on, the quarantine regulations state less than 3 feet, you have to quarantine. If you take the mask off inside, it's 6 feet, correct? So I mean, it would double close contact tracing. I don't know what strain we put on staff to see what it is, but those are regulations that are in place, not by DESE, I don't think. Maybe it's DPH. I don't know. So like those are things that would impact learning of students, because then if they're quarantined and they don't want to do test and stay, then they're just home. They're doing worksheets, but they're home for 7 days. So like that's also part of that makes the decision. And I get, so I mean, if in the end it gets voted to send a letter asking it to come back, I'm just trying to preemptively say where I stand on certain things. So that's all.
Wendy, if I can add in, I don't know if we're moving. So I just wanted to say that I respect that you all have your opinions. They are all valuable, and I just hope that you respect all the opinions of us as individuals sitting up here at the table as well. It's just like for you, it was really hard to come up to the podium and say how you feel. It's not easy for any of us to look out at you and say the same things. So I respect that and thank you for your patience with us. I'd like to say that I do wholeheartedly agree with what Chris said about it being really tough, because even though we want a decision made, I think all of us want the decision made that we want. So while I do hope that we'll be able to give parents the choice, that DESE will allow us to unmask our kids in school as soon as possible, I do also agree with what Heidi was saying, that I would like to maybe wait until all kids are eligible for the vaccine so that all families have the chance to vaccinate. If numbers are trending down and if DESE refuses to lift the mandate, I would absolutely revisit sending a letter at that time, asking for control back to the local community. For now, I also support, I wouldn't be opposed to the last letter requesting more information about how they came up with that, with the decisions that they've made, the benchmarks that they have.
Thank you, Danielle, I appreciate that. Okay, so, do you want to say something? I thought
Nope.
So this letter, I kind of get the feel of how you guys are all going with it, which I assumed anyway. And, you know, I mean, like the Hanover letter was the first letter that ever went out, you know? And then once the sandwich letter came out, I was like, oh, I like this better. You know what I mean? But I still had that letter. So it's like, what are you supposed to do? That's why I wanted to, you know, put these other two in there, because the sandwich does do a great job with questioning and, you know, like wanting answers. So I totally get that. So if it's okay with you guys, like if you guys would want to vote on this, I will, but I kind of just want to see if we could push it aside and not to put it on our agenda, but in case something does come up, like I know that they were talking about maybe in November with the vaccinations, so we could bring it back to the table if we come closer and the agenda, you know, is okay. Are you guys okay with that?
I think,
Or
yeah,
do you want to vote on it?
I think that's an okay decision too. I know last time we said kick it to September, but I think sending, so I'm comfortable with voting to send, I don't want to plagiarize sandwich, but if they give us blessing, like I'm okay with, I mean, I'll vote on any of them. I'm just telling you, I'm going to vote yes on sandwich if we vote on all of them. So that's what I'm at today anyway. So.
I appreciate that. Do you guys want to vote on this, or do you want to kind of table it but not table it?
I mean, for the sandwich letter, I would vote to, you know, I'm not opposed to it, but I don't, like, I want more time to look at it. and
I will say, I
let us
find the
edit it.
sandwich letter slightly wordy. There is, I'd have to strike the word unprecedented twice in the same paragraph, because that's just how I roll, I'm sorry.
I mean, are we allowed to vote to send like a letter like that?
Well, yes.
And then
so
revise it, and we can look at it ourselves before, we don't have to bring it again, do we?
No. Right? No. Like if we already agree, right? So let's just forget about Hanover right now. If we look at Sandwich and the Silver Lake one, and what I'm asking is if we look at Silver Lake and Sandwich and just say that we can pull something together for our community in agreement, like we did with the letter to recommend but not enforce masks, I would like to do that with all of you.
I mean, I do believe that people have the right to clarification and to question some of the arbitrary nature of what is happening for sure.
So that's what if that's okay, would put the Hanover letter aside. And, you know,
To be clear,
and
we're
just
calling
take
this
little,
one Hanover.
if we can put the Hanover letter aside, yes.
Yep.
And then just, and I'm not saying like we're gonna take every word or every paragraph or anything, but just to say that we will write something similar.
We have to
you
maybe
know.
bring that final letter to another
So
meeting.
if you want to vote to send that letter and, you know, adjust the mechanics, it doesn't substantively change it in any way, I think that's fair. But if authoring changes something that somebody here voted for that changes the substance of the letter, then that would be a problem.
So I don't think that I would want to change like substance of the letter, but like you said, you know, you're
Grammar is one thing,
grammar,
right? Yeah.
right?
Yeah.
And,
Sorry.
and there's like the Silver Lake letter. There is a lot in there that refers to the Hanover letter. That I know how you all feel. That I wouldn't put that in there. That, like I said, it would all be in agreement.
Yeah. Modeled after the sandwich letter.
That asks the Department of Education to
That's what I was gonna say. So you could vote to write a letter modeled after the sandwich
Okay.
letter.
Thank you.
And we'd all get a look at it before it
Right.
got sent.
Right.
Okay. I'll make a motion to draft a letter modeled after the Sandwich School Committee letter that's in our packet.
Thank you. I will second the motion. All in favor?
Aye.
Aye. Thank you very much. All right, so next on our agenda is the report of the Director of Curriculum, Instruction, and Assessment. So this is from the English department.
First in the batting order is
Is Dr. Gonzalez. Gonzalez, I'm sorry. I'm sorry.
You won't judge me for striking the word unprecedented twice in one paragraph, right?
Like variety, vocabulary, and syntax.
It is of the utmost importance.
That's how I roll too. So, good evening. I have been asked to comment about the English department at Abington High School. I've been asked to comment on the strengths, the challenges, how we're addressing challenges at Abington High School, and about the progress of the advanced placement coursework at Abington High School. I do have some extra handouts if you do have one and you'd like to share, and I'm sure there are a couple here also, and we can make them available to you.
They're on the website too.
Thank you. So the first strength of the Abington High School English department is its experienced, skilled teachers. Our curriculum is based on authentic text sets. We don't read clips in textbooks. We read whole texts. Our pedagogy is consistent. We are based on common essential questions that every teacher at every grade uses and builds on. We use common assessments from grade to grade, from text to text. We concentrate on metacognitive and critical thinking strategies, and we work to build student voice and student choice in the ways that they demonstrate their knowledge and their skills. We also think that the strength of our department is in the number of student growth opportunities we offer our students. In grades 7 and 8, we have heterogeneous grouping and differentiated instruction. We do not have levels in grades 7 and 8. Every student has an opportunity to show their strengths together and to not be judged by their weaknesses, but to have instruction that matches them. At the high school, in grades 9 and 10, we have levels 1 and 2. We have common content, common assessments, but the teachers adjust their instruction for the students in the room. We have effective collaboration with our student support team. There is fluid movement between levels. You can start grade 9 in level 2 and end as a senior in advanced placement. Teachers watch carefully, parents and students advocate for themselves, and they can move and advocate for what that best fit is. We've closed MCAS score gaps, not completely, but we are closing them, especially for our high needs students. And in our advanced placement class, we have open enrollment. If you would like to be in advanced placement, you may sign up for it. 25 to 30% of each class in grade 11 and 12 on average stay in a 2-course loop from AP Language to AP Literature. So those are our strengths, but we are not without challenges. It is a challenge to invite students to give more than the minimum, because many students want to pass and move on. How do you get someone to reach for more than the minimum? How do we engage passive students who would prefer to remain uninvolved? How do we get students to read between the lines and beyond basic facts? How do we get students to generate ample evidence to give more than one reason for their answer? How do we get students to pay attention to how an author works in addition to what an author says? How do we support our English language learners? And how do we expand elective offerings and keep class sizes down at the same time? Those are our challenges. And we're trying to address them. We are trying to get students to focus less on grades and more on what they know and are able to do. We try to get students to focus on asking questions as well as answering them. We build background knowledge so students can make connections to the text, to the world, to each other, and between the texts that they read. So with each new text, they bring more background to it. We are working to select texts for equity so that each of our students can see someone like themselves in the content of what they read. We're using technology to support our multilingual students, whether that technology resides on a cell phone or on a laptop or on some other presentation tool.
We are working to tell students that listening to an audiobook or reading a digital book is real reading. And we're making sure that students, even beyond those students who qualify based on IEPs, for audiobooks, if we can find access to an audiobook, we want students to participate in the act of reading, whether they do that with their eyes or their ears or both at the same time. We are using film, documentaries, and multimedia projects to present information, because that is the way of our world, and we have to read that critically as well. And to build reading identity, we are working with our school librarian to promote book choice, book clubs, and time in school for reading. So those are our challenges and how we're working to meet them. Our grade 11 students who elect to take advanced placement take a course called AP Language and Composition, which focuses mostly on nonfiction reading. Our enrollment averages 26% of the class over 5 years, with as few as 18% in some years to as many as 29% of students in a class. So close from 20 to 30%, from a fifth to a third, elect to take AP. On a 5-point scale, they average 2.8, and scores have ranged from 2.25 to 3.03. 3 is the general cutoff for getting college credit. 56% of our students on average earn college credit while they're in high school through advanced placement. Some years it's as low as 25.5%. Some years it has been as high as 73%. What makes it challenging is some colleges are changing the score that they want to use for college credit, or they might not feel that high school courses are as demanding as college credit. Our seniors take AP Literature, and many of them just move from AP Language into AP Literature. On average, 27% of the class enrolls. 18 to 38% of our seniors, depending on the year, take AP Literature. 2.5 is the average score, and in the last 5 years, it has ranged from 2.48 to 2.89. 37% of our students average scores of 3 or better and earn college credit while they're seniors. So some students earn college credit in both classes while they're at Abington High School. It has ranged from 37.9% to 51%. So many of our students take advantage of this opportunity and move into college with college credit in both English courses. So that's my presentation for this evening, and I'll be happy to take any questions you might have. Thank you. Yes.
If I can just read a few things, I just have some comments.
Sure.
I had asked to have each department present this year because I care so deeply about what goes on in our kids' classrooms. After 22 years of teaching, I still think that teaching is the best profession on the planet. And even on the worst days, I would take it over any job out there. And I appreciate all of the work that our teachers do. One of the most important elements of a healthy school is honest reflection on what is and isn't going well. And from there, open dialogue on what's necessary to improve. And we are doing such a good job educating Abington's kids, but our work doesn't stop. There's always room for growth. And I am so happy to have this opportunity to be open and honest with the community. And I appreciate Dr. Gonsalves and Mr. Scott being here to offer this honest reflection. It takes a lot to put out all the challenges and the things that aren't going so well. For our English department, there are many over the years who have continued to ask, what's the difference in these AP scores, the advanced placement classes that are the highest level that are offered to our kids? If you compare in the surrounding communities like Hingham, Duxbury, have higher scores than we do have in Abington, and it's so easy to say that maybe the schools have better teachers, but I'm going to say that we have some of the best around, and for sure that is not the case. So I just wanted to put out there that I ask you to consider that there's no better way to increase the productivity and achievement and to help our teachers out than by supporting our kids and setting norms and expectations at home. So I'm hoping that we can give our teachers the best base possible and show our kids that we're valuing education at home and keep our kids reading at home and doing their work and not using Cliff Notes. And with all of your support with the community, they'll be able to do their job so much easier, better. The classes will be more engaging, and I'm just truly grateful to our teachers. So thank you for that.
I appreciate it.
Yes. Thank you, Judge. Thank you, Danielle. Anyone else? Heidi?
Oh, I have all the questions.
Sure.
Yay. So first of all, thank you. Thank you for all of this, and especially the challenges. It is really hard when you work so hard to sit down and put in front of everyone, well, hey, this is what we need to work on. And so, but I love what I see here, because it just means that there's a place to go from. And I noticed that class sizes is one of the things that is being looked at. And, you know, the elective offerings, they're important because sometimes those are the things that drive our students who need more motivators. So, you know, whatever we can do to be supportive to kind of drive that process. The authentic text set curriculum, is that something you're choosing, or is that something that's coming from elsewhere?
So we have been, for the longest time, deeply committed to the Language of Literature series by McDougall et al.
Okay.
And as we aged out of that textbook series, we brought in several companies. Pearson was one of them, and Holt McDougall, which was the successor of McDougall et al.
Yep.
And also EMC Paradigm, which is a textbook that was adopted in grade 6.
Okay.
And what happened was the teachers in the English department listened to the presentation, they looked at the textbooks, and they looked at the cost. And they thought that they would get the best outcome for our students from reading whole, authentic texts. And rather than have students carry around a 6 to 8 pound book, that students would be reading more authentic literature in completeness rather than in fragments. And the assessments that were tied to those were kind of geared toward a test-taking industry rather than building an authentic relationship with students as readers who would be lifelong readers. Very few people say, I'm a lifelong reader because of the textbooks that I had in grade 11.
Correct.
But it's because of a poem, a novel, a play, a memoir that they read. So we're skipping the textbook stage and putting those authentic texts in students' hands. So that was a consensus of the department after examining several textbook series, deciding to do it this way. So with the central text, they would locate short stories, sometimes using something like Common Lit, or using stories that are in the public domain, using poems that are in the public domain, purchasing DVDs that are good matches in terms of documentaries for the things that we do, and thus try to invite students to engage with authentic, real texts, rather than texts that have been processed through textbooks.
I love that. I know at one of the meetings you had talked about, you were piloting a program where the students were choosing their text. This was a couple of years back.
Yeah, and we have gone on, even in a pandemic. We have one of the most wonderful librarians, Patricia London.
That's my next comment.
And I taught Romeo and Juliet to freshmen. We watched 2 movie versions of it. And then we said, is Romeo and Juliet really still inspiring writers today? And Ms. London found enough textbooks so that, not textbooks, young adult fiction inspired by Romeo and Juliet, so that each student could walk out with a hardcover book in their hands, in addition to having audiobook excerpts. And they could really see that for themselves. So we're trying to, at least once a year, have students say, what books have been inspired by this book that we choose? And let them have a referendum on that.
And I love your collaboration with her, her dedication to not just her job, but Sora, and being sure that everybody has access to materials. It just blows me away on a daily basis. And the fact that you are all on the train of audiobooks aren't cheating, I so appreciate, because this is part of my job too, is putting audiobooks into everybody's hands and saying this is a great way to enjoy all manner, nonfiction, fiction, poetry, whatever you want. So I appreciate that. One more question, if I may.
Sure.
Do you have a threshold of where you would like to see your AP students? Is there a goal that you're hoping to see as a department for, we'd like to see this many kids kind of hit that 3? Something to drive for.
We would like to see every student to perform to the best of their ability on any assessment test that they have. It doesn't matter what it is.
Right.
For advanced placement, there are a lot of factors. The advanced placement test in language and literature have changed substantially, as have their scoring guides in the last 2 years, have been taken under unusual pandemic-related circumstances, both in instruction and assessment. I think the years where everyone scores 3 or better, or 75% of the kids earn college credit, is awesome. But the other thing is that we have gone away from applying to AP or being recommended to AP or being excluded from AP to accepting everyone. And when you accept everyone, even the students you take a gamble on might not do well. The thing that the College Board and teachers would say is every student who has an opportunity to participate in the most rigorous instruction and assessment brings that experience, not necessarily a test score. So we want to invite as many people to the table as we can to do as well as they can. So we don't have a magic number. We would like to see everyone earn college credit. But the fact of the matter is, if you go to Bridgewater State and you sit for their placement test and you score well on the placement test, you can skip a year of English without ever having taken AP.
Right.
And one of the things we've been very concerned about is the College Board has raised its price. It's $134 to take an AP test.
Ugh.
That is subsidized for some students in part, but not in whole. And that excludes some people from the table. They have to make a
Absolutely.
commitment in November, and they don't get a refund if they decide not to take it. And if they decide to take it late, they pay a surcharge. So we've removed the requirement for having to take the exam from the class itself. To be honest with you, the data that goes forward where students don't take the exam but take the course is not something we're going to be able to collect.
No, I would far prefer you allow kids the opportunity to jump and fly than to tell them that yes, no, or it's for me to decide. So thank you. No, I like that.
Please know that there are some states, I have a niece and nephew who grew up in Florida. The state of Florida pays for their AP tests.
Yeah.
There are communities, whether they're counties, parishes, or so forth, that pay for AP testing. And that's not something that we do. And once you put a price tag on an opportunity, there are people who are excluded.
Correct. Correct.
So, yes.
All the
Just one
questions.
more, nothing
Oh, sure.
that needs to be answered now, and I can send this to you by email. But just wondering about sending people out to do professional development, either courses, going out to, I can't even think of the word.
With the College Board and the workshops themselves?
Going out to conferences, sorry, I couldn't think of that. So going out to do conferences, courses, I'm just wondering, over the past 2 or 3 years, maybe a year pre-COVID, how often have our teachers gone out? And just curious for the courses that teachers have taken on their own time, just curious to see what kind of things that we're interested in, and sharing out, is there some collaborative lesson planning that's happening from those courses that teachers are taking individually?
So we are so fortunate at Abington High School to have bi-weekly common planning time, and the advanced placement teachers take advantage of that. Anybody who teaches an advanced placement course has been exposed to several College Board workshops before they take that, and the teachers who are taking it now have received instruction on how the new test is scored, and every course that is offered at Abington High School has passed an audit by the College Board and is returned if it's not sufficiently rigorous. So the teachers have all participated in professional development, and the teachers who are teaching right now have master's degrees and or are in process of gaining a master's degree, and remain the kinds of people who seek conference opportunities. Conference opportunities have been far and few between in the last 2 years, of course. And there's nothing like being able to go to a conference, but when it's virtual, I hate to take a day from my students, especially in a time when substitutes are so short, to go for a conference when I could be in front of my students. So the kinds of conferences that are during summers and weekends, it would be great. I have enjoyed tremendous support from the district for sending teachers to conferences, and for that I'll always be grateful. But it always comes with that disadvantage of taking time from your students in the classroom. But we have been, and the College Board is our principal provider, both regionally and nationally.
I just have a quick question. So as a parent of 2 kids who took a total of 3 AP classes between the 2 of them last year, I'm all for, I think it's great that the way we're set up is that anybody is welcome to take these classes. My question is, are kids, and I guess last year, I admit I totally flaked on parent-teacher conferences, so I didn't have the opportunity to ask this myself.
Sure.
Are kids and parents sort of given realistic expectations at the beginning of the school year of that class about kind of the chances of passing the test? Because I will say, for example, my kids did really well in both classes, but when they went in to take that exam, they came home like almost in tears. They had no idea it was going to be so difficult. They felt that, they were not, and, they did okay on the English one, definitely did not do great on the history one. And I was a little surprised by that. So I just would like to know, ask if it's not happening, and maybe my kids just didn't communicate it to me, if there is sort of a conversation either before going into the class or at the beginning of the year about, hey, just so you know, even just because you're taking this class doesn't mean you're gonna knock the test out of the park. Because that was a hard lesson for them last year, an unexpected one, I think.
What I would say is that sophomore year, we give students a timed writing sample. The same time we're talking about course selection. This is the kind of assessment that you might do in AP, and it's scored and returned to them. So already they get a little alarm, if you will, or alert that this is the caliber of work that they would be doing. Students do practice tests during the course of the year. It's been a long time since we sat down for a 4-hour mock test, which is something some districts do. But it usually involves them missing other classes or coming in on a Saturday. Mass Insight, no problem, does that. But they do, the regular assessments in the classroom of timed writing contribute to their grade, so they'd be aware of that. In those courses that they take in professional development, they're trained to score and calibrate their score to meet a new rubric. But the rubric is new in the last 2 years, and we haven't really had either optimal instruction classes, where students meet every day with their teachers, and 2 years ago was an abbreviated test, so the testing conditions have been different. It will probably take another year or 2 to match the testing, the instruction, and the student performance. But students are given grades based on a College Board rubric, and they should be adequately prepared. But it is always a difficult test because you don't know what the literature is going to be, and it can be from 1550 to 2020. So it's a large breadth, and it's much more about having the habits of mind as a reader and being able to put aside all the distractions that you might have as a student.
Okay, thank you.
But thank you. We try our best.
Yes, I'm sure.
Okay, thank you, Dr.
Thank you.
Gonzalez.
Thank you.
We really appreciate your time. That was very, very good. Okay, so next for informational, nope, I'm on the wrong one. Thanks. Where am I? Wrong one. Hi. Okay, History and Social Science Department update from Mr. Jason Scott, who's the department head. Thank you, Jason.
Thank you. Thank you for the opportunity to present tonight. So my name is Jason Scott. I'm the department head for the History and Social Sciences Department, and I'm going to go over the same things that Dr. Gonzalez went over. So I'll start with some of the strengths of the History Department. So right off the bat, we've made a years-long commitment to writing as well as forming argumentative presentations in class, and as well as, like I said, in the writing samples. So this has been something that is tiered from grade 7 through 12 so that the students have a common focus, common language, and common goals throughout their experience in the required classes in the history department. Another strength of the department is we have a very veteran staff. This shows itself in the classroom for the students, but it also shows itself in the way that our staff in the department is leaned on as building leaders, so mentors for new teachers, people that will lead groups, whether it be in breakout groups for the staff, or opportunities to present something or a new skill. So this is something that the history department is definitely able to present for the students and the staff. And then we also have a great depth of elective course offerings in the history department. So right now we offer a law class, a psychology class, a Holocaust and human behavior class, a history versus Hollywood class, and a leadership seminar class. These are some of the most popular electives that students take year in and year out. I guess the only, not to jump ahead too much to areas of improvement, but the challenge, the good problem that we run into sometimes with this is we don't often have the staff to run all the classes that the students are interested in taking. So, but when these classes run, like I said, they're among the most popular classes that students will take, and give them some introduction into courses and material that they might pursue for a career down the road. In terms of areas of improvement that we're looking for as a department, I have 3 major ones here that I'll list. So we want to continue our work in terms of making connections between modern day and events of the past. I think that's one of the best ways for students to connect with history, is to connect it to what's going on now. And I'll speak to each of these in a little greater depth as I go into them, just to introduce them now. So the second area of improvement is to continue to work on identifying bias in source material and evaluating the credibility of sources. And then the third skill is working on students' presentation skills. So I'll speak to each of those individually now to go into a little greater depth to how we're trying to address those areas of improvement in the past and this school year in particular. So related to making more modern connections to events in the past, this is definitely something that we decided as a department at the beginning of the year that we wanted to focus on this year, and we're going to use a considerable amount of our Wave Week Wednesday time every other week to meet and talk about that. What that usually looks like in practice is essentially a brainstorming session. So for example, myself and the other United States history teacher we're teaching the Spanish-American War right now, and so we talked about, this is a great opportunity to bring up Puerto Rico's status, for example, and why that is a territory in the United States to this day, and how it dates back to the Spanish-American War, making those connections. So that's one of the ways that we're trying to do this, and like I said, these are often solved and worked with brainstorming sessions throughout the year, where teachers can talk with each other. They're each other's best resources. Regarding continued work on identifying bias in source material and the credibility of sources, we as a department focus very heavily on primary source analysis. This is something that we've taken and designed a tiered approach that, like I said, goes from grade 7 to grade 11, where they have those 5 required classes. What that looks like in practice is in grade 7, students might work with a single document or one thing from one perspective, where they can break that down and start to learn the skills and the tools and the language of analyzing those documents, all the way up until junior year, when they'll be presented with multiple documents from different perspectives and be expected to form opinions and evaluations using those documents. Related to presentation skills, this is something that primarily lives within our business department, which is part of the history and social sciences department at the high school. But certainly presentation skills are a big part of the history department as well, for our history courses. But our business offering allows students to have many real-life situations where they'll be expected to do public speaking and presentations. A couple of examples would be students are asked to create some kind of business or business venture and then carry out an elevator pitch where they have 30 seconds to sell their classmates or their peers or the teacher on why something like that would work. They do Shark Tank simulations in the class like they would do from TV. And then on a day-to-day and week-to-week basis, students are given multiple opportunities to practice individually and in small groups, as both of those skills are essential in the working world. So those are our major strengths and areas of improvement for this current school year. And then I'll speak to our AP data as well. And then I'll be happy to answer any questions beyond the course too. So in terms of AP, we offer 2 AP classes at the high school. Junior year students are able to take AP US History. Senior year they can take AP European History. Similar to the English department, these classes are all open enrollment, so any student that wishes to take this class can take the class. In terms of the specific data, I'll highlight some of the numbers that I think are most relevant. So for U.S. history, for our juniors, over the last 5 years, we've seen anywhere between 23.5% and 71.4% of students who take the exam earning a 3 or higher, the general threshold for college credit. In our AP European history class, while it didn't run the previous 2 years, it's currently running this year. It didn't run the previous 2 years, so that the 3 years prior to that, it ranged from 58.3% to 100% of students earning a 3 or higher. And these are classes where, so the exam is a focus of the class, certainly, and it's something that's relevant and the skills that go on, but I think both of these classes also emphasize the historical thinking skills in college prep so that they're going to get in what they're going to need to do in the classroom. I think one of the comments that I think stands out to me is a student who took the breadth of our AP course offerings and went on to go to Harvard University and said that those were the 2 classes that prepared her most to be successful at Harvard. And so I think regardless of scores on exams, that is the primary focus is in terms of allowing students to be successful in the college classroom. And so, like I said, these are open enrollment classes. In addition to that, we give kind of like every teacher in the department gives an overview of all of our elective offerings in the springtime when students are signing up for courses, so they know that it's an option for them and that it's open enrollment. And then regarding expectations for the class, we meet with all of the students in the springtime before summer vacation to go over summer reading expectations and to answer questions for the students about what the classes are like and to explain to them what the day-to-day expectations and workloads are like for those classes. So that's a little bit about how we try to draw students into the AP classes. This year, just to get a sense of enrollment, 26 students in the junior class are taking AP US History, and 15 students are taking AP European History. So these are pretty popular classes this year. And then regarding business, so just to give an idea of our business enrollment, over the last 3 years, anywhere between 251 and 230 students are taking a business class at some point in those school years. And then specifically the personal finance class, which is a class that gives students the opportunity to do most of the practice in terms of resume creation and job skill interviews or job interview skills. That ranges from 28 about 3 years ago, or 3 years ago specifically, to 77 students are currently taking a personal finance class that's for juniors and seniors. So it's a lot of information, but that's what we have to offer, and we enjoy working with all the students that we work with on a day-to-day basis. Thank you. Yeah.
Sorry. Just 2 questions, comments. This is no surprise to those that I've talked to before, but I would love to see a personal finance requirement for all students.
Yeah.
So I'm just going to keep pushing that more than AP Calc and everything else out there. Getting our kids financially literate is definitely super important for me. So I love to see the increasing numbers, but if there's any way that we could ever make that happen, I would like to see that for our kids. And just a question of, have we considered switching AP European History to AP World for a more global view?
Yeah, that's a great point of view. In the past, so the AP European History is relatively new. It's we've had it in our program of studies for about 5 or 6 years. To be frank, the main reason that it went in is we had a staff member who was specifically interested in starting to offer AP European History as opposed to World. And that's why we chose to pursue that, because she was trained through College Board, or became trained through College Board for that. Statistically speaking, the AP European test is a little more popular in the United States than the World History test. So those are, to answer that question directly, that's why we have Euro as opposed to World. I would love to offer as many classes as we can. It usually comes down to staffing and what we're able to provide for the students.
Thank you.
My turn. I've noticed that especially the identifying bias and creating credibility, and you talk about starting from grade 7 and working up to grade 11. I've had conversations at my house, so I know it's being taught.
Good.
But do you have time with the middle school teachers as well to be sure that, do you get to have crossover time to plan and make sure that everything is being continued all the way through? Because it sounds like it is.
Yes, so me specifically as a department head, I have some release time in my schedule to be able to do that, so I can go over independently myself to work with those teachers when they have common planning time, whether it be the grade 7 teachers or the grade 8 teachers are all together. So that's something that I do to help kind of guide that and be a resource for them for what they're going to do. And then usually in a given year, it depends on what the district's plan is for professional development from year to year. But we usually have anywhere between 2 and 4 days in a year, a school year, where we have professional development time as a 7th through 12th group to specifically talk about what our goals are, how the progress is, what skills and things like that we're using. So to answer your question, yes, we're together multiple times a year, 7 through 12 to do that.
Awesome, thank you. This is fabulous.
Anyone else?
Mr. Scott, I have a quick one. I guess I could have asked the same question as Dr. Gonzalez. So I'm just unfamiliar. Is AP only offered grades 11 and 12?
Yes, sir.
Okay, because I heard those used the example, so I was gonna. All right, thank you very much.
Sure.
Julie, anything? No. Okay, I just have a quick question. First of all, I just want to say that this is great. The presentations that you guys both put on, you two both put on, I really appreciate it. My question is actually if you could just explain, because I know that people have asked in the past, and I know that you're the guy to go to. CRT, like, I don't mean to get this going or anything, but can you just touch on that? Like, is it being taught? Is it not being taught? I know that we put a letter in from Desi, but, just getting it from the guy himself is probably best.
Yeah, I can answer the question in
Thank
two
you.
ways. So you're referring to critical race theory?
Correct.
I assume not culturally responsive teaching?
Correct, you're right.
So, to answer your question 2 ways. The first way, does our curriculum or do we in any way teach critical race theory on a day-to-day basis? No, that's a college level or graduate level material.
Correct.
To answer the question a second way, which I think would be a bit disingenuous to just say, no, we don't teach that, is of course we teach a curriculum that's rooted in the fact that race and racism plays a part in American history. And so that's something that we couldn't teach our classes, honestly, if we ignore that, because this is something that obviously we don't want those incidences in America's past to be repeated, and we want to learn from those mistakes and challenges of the past. So do we teach critical race theory? No, that term gets thrown around a lot, and it's not something that's part of, to my knowledge, any high school curriculum. But like I said, we do race and racism factors in heavily into our curriculum.
Thank you, I appreciate that. Thanks for clarifying.
Of course.
I think that's it for us. And
Thank you.
thank you
Thank
very
you so
much for
much.
coming out tonight.
First bell rings early tomorrow.
Yes,
right?
it does.
I know,
Thank
sorry.
you. It's
Thank
late.
you.
Thank you.
So next we have the professional development offerings for staff by Dr. Fedorovitz. Thank you for being here.
Good evening, everybody. I'm just going to give a quick overview of our professional development that we're offering this year for teachers. So these are our hack days that we have when the teachers are getting some training. So this year's professional development has focus areas around improving instructional strategies, supporting social emotional needs of students, and mitigating learning loss. Through building capacity with teachers, we're better able to support the learning needs of our students. So basically our goals are to recreate expectations in learning through pedagogical and instructional training in order to reduce the learning loss, support our teachers with high leverage instructional practices and supplemental materials for implementation in the classrooms. So starting with pre-K or our AEEP program, they're looking at a new learning program called Learning Without Tears. So they're going to spend most of their years working on this and rolling it out. And basically, it's a hands-on approach. It's a hands-on program of instructional resources that encourage purposeful play and active engagement to meet all the needs of our learners. At our elementary buildings, Beaver Brook and Woodsdale, we're working with a company of consultants that are literacy specialists in Teaching and Learning Alliance to implement a newly developed curriculum and support explicit and rigorous teaching in the reading workshop model and establish routines and engage students Also looking at intervention models as well to help all of our students. At the middle school, the primary focus this year is on implementing something called the Second Step Social Emotional Learning curriculum. And it's basically responsive to the needs of today's students based on the latest research in adolescent brain development and social psychology. At the high school, we're working this year around conversations and dialogue about standards, expectations, and student motivation. The focus is on defining standards and expectations for school-wide understanding and beginning our work to identify areas in the classroom where teachers can positively impact student motivation. Our paraprofessionals district-wide are attending a systematic professional training to understand learning disabilities, behavioral management in response to drama, and the use of technology to support students with learning disabilities. Our elementary TLC program will be working as a steering committee with the Accept Collaborative to help with making the best use of best practices in their specific classrooms. And then this year, during our district-wide training from Dr. Khalees Warnham, educators will be attending and participating in cultural proficiency training. Educators will be exposed to strategies to counter the negative effects of microaggressions, implicit biases, and racism in the classroom. Teachers will have the critical reflections on practice to value every culture and every child in order to create a learning connection to all contents and topics. The purpose is to make teachers more aware of the background of their students with the benefit of helping teachers create a more sensitive classroom. Here, educators are able to be more reflective of their classroom environment that is created for kids, which in turn prepares our students for life beyond Abington. That's it. Any questions?
Any questions?
I do not at this time.
No. Thank you very much, Dr.
You're
Fedorowicz. We
welcome.
appreciate your time.
This is great. Thank you.
Thank you.
We don't want to keep you if you want to head out with your son. Next is the athletic director report. Mr. Peter Serino. Yes.
Thank you very much for the opportunity to speak tonight. There's obviously a lot that I could update you on with the athletic program, and I'm going to try and limit it to two things. So the first is 8th grade participation. So earlier this year, for the first time that I'm aware of, this group voted to support the idea of 8th graders participating in high school athletics. We did apply for the waiver from the MIA that's required for all of our fall sports with the exception of golf. And the reason we didn't do golf is we didn't need it. So there has to be a need to use 8th graders. So overall, it's going extremely well. There's been a lot of positive feedback from the kids, first and foremost, the 8th graders and the high school students, coaches and parents. Not everything has been perfect, which we anticipated. I think we talked about that going into it. There is an opportunity for some people to be upset and be disappointed. But it's a great time for kids to be disappointed because they're never more supported than they are right now with the school staff, the coaches, the teachers, and then at home as well. So it's a good learning experience. So while we never want kids to be disappointed, if they're going to be, this is not a bad time for it to happen. Administratively, there's of course been a learning curve for the middle school. It's a new group to work with, and there's new expectations on the students that we have to hold them accountable. But overwhelmingly, I'd say it's been very successful. So we have 27 8th graders participating. The football, we did not have anyone choose to participate, even though we did receive the waiver. And then the most any individual program has is 6. Each soccer team has 6. Each cross-country team has 4, so it's a total of 8 with cross-country. Cheerleading 2, and volleyball 5. So just to give you one program's example as to how it's going, the girls' soccer team I think it's not just the girls' soccer team, but I think it illustrates it. So we have 17 players on JV. So you might look at that and say, well, why do we need it? 6 of them are 8th graders. So if we take the 6 8th graders off, we would only have 11 players left, which means if anyone is sick, can't make a bus, something comes up, we can't play a traditional game. Also, there's no substitutes, which sometimes can be challenging. And then additionally at practice, the practice becomes challenging with just 11 players. So being able to have 17 allows for a traditional practice, a traditional game schedule, and kids can practice the appropriate skills based off where they are. They're not being forced to practice with a varsity team or whatever. And also it allows players who maybe are on that JV varsity bubble to go up and play varsity, to have that opportunity. Because if we didn't have those 8th graders, those players who maybe could go up and play a half or get some exposure at the varsity level because they've worked hard and deserve it, they would have to stay down so we could field a second team. So I think the benefits that most people see and are obvious are for the 8th graders. They get to play a sport and participate, and without it, they weren't. But the clear benefit is for the high school students as well. It gives them a much more traditional opportunity to play and practice the way that high school sports usually are. Some unintended benefits that I didn't think of when we applied this is I had a parent of an 8th grader reach out to me and thank me, and they're not playing a sport. Just the social interactions that it created, where their 8th grade child was going with friends to watch the other 8th graders play, they thought was great because they had missed out on so much. So to have an opportunity to go watch a soccer game or watch a volleyball game with their friends, to stay after school, do some homework, and then go down to the gym or out to the field, is a great thing that I didn't think of in planning it, but it's kind of one of those unintended consequences. So moving forward, we do intend on continuing to use it where it's needed. So that's the requirement of the MIA. We can't displace any high school student who is interested. So for the winter, I do anticipate, based off of historical trends and talking with youth programs, every sport that we offer, so boys and girls basketball, ice hockey, cheerleading, and indoor-outdoor track, to apply for the waiver. There'll be different degrees. So hockey, I believe the 8th graders, most likely based off of trends, will be participating at a varsity level. Whereas on boys basketball, it will most likely be the freshman level. So they have to go at the lowest level we have offered, as I referenced before. So it will be varying. The one opportunity in the winter that I don't anticipate is wrestling. So our wrestling team is a co-op with Rockland High School. So it's usually, to sustain a program, you can go one way or another, a co-op or an 8th grade, and we're the guest in the co-op. So we will stick with the co-op, so our high school kids will have that opportunity, but I don't anticipate the 8th grade waiver for that. The process for deciding that is probably mid-October. We'll have our interest meetings after school where kids come, and then based off of that, we'll kind of analyze the numbers and see if we need the waiver, and we'll use that to do it. So that's the 8th graders. If anyone has any questions on that.
Peter, I mean, we've talked, you and I have talked about, so, and I know, and I was just asking Mr. Schaefer, I can't remember when we voted, did it cover this, it covered the entire year, but did it cover beyond the entire school year? Our vote to allow the 8th graders to participate?
I don't believe so. I believe we were going to update you as it went, and then in
and
June,
I appreciate, I
again.
greatly appreciate, and like, I think everybody can agree, it clearly will benefit the 8th graders that participate. But the intention behind the program was that they were the secondary beneficiary, not the primary. The primary beneficiary were the high school kids who got to continue to play. And I appreciate you getting all of the information from talking to kids as you go. I want to let you know one of the things that has gone through my mind, and in no way do I want to change anything for this current year, but maybe revisit, is that maybe 8th graders are only allowed to participate if there is a level below varsity. That's something that's going around in my head. I just want to make you aware of it now as opposed to hitting you with it in June. So it is a thought I've had, as I've heard from some different parents and things like that.
Yep, that's fair. And just so the MIA rule is they have to participate at the lowest level offered.
Right, so I mean, if a level is not offered below varsity, then 8th grade, because you said you don't have to apply for every sport. So part of my thinking right now is that those sports possibly I would not vote to allow, like that's how I would word an approval, me personally. I mean, that's just me, so.
You would want to break it up.
I would just want to say I would vote to, right now, so this is September 28th.
Right.
Just hearing different things, I tend to feel that I would want to almost say 8th graders are allowed to participate in any level below varsity, if that makes sense.
So I think he's, can I just try?
Yeah, I know what you're saying too.
Yeah, so if.
I don't want 8th graders on varsity. I mean,
If in hockey it's only varsity.
then they can't participate.
Then they can't
Correct,
participate.
that's what I'm saying.
Correct, so just, for information purposes, in the fall, the sports where 8th graders are playing varsity would be boys and girls cross country and cheerleading.
Okay.
And then in the winter, again, this is anticipating,
Yeah.
it would probably be hockey, cheerleading, and indoor track and field.
Okay, thank you.
I have a quick question. So if somebody's in 8th grade and we have, a JV team and a varsity team, the person in the 8th grade can move up though for games to the varsity? No, not
No,
even
they have
one
to play
game?
at the lowest
Okay,
level offered.
perfect. Just
And
wanted to-
and I've gotten the question, if there's no JV game tomorrow, but there's a varsity game,
Yeah.
could they play in the varsity because JV isn't offered? And the answer is no, they have to play and stay with the team. And also the question comes up, when the tournament comes and the JV season ends, can they go up? And the answer is no.
Good to know. Anyone else have questions?
No, I think it's also important to note that we are not the only community doing this. And I mean, for example, soccer tomorrow,
Mhm.
we lost our opponent because they couldn't field a JV team. So there's that. So I know that people might be wary of the whole 8th grader thing, but so far, what I've seen in action personally has been really nice. And it has been nice to see more kids at the fields cheering on teams and teammates and things like that. It's really kind of cool to watch.
And the majority of our league is now using 8th graders in some capacity. Some schools are 7 to 12, so they don't require the waiver. And other schools are similar to us where they do need the waiver.
Thank you for that. We really appreciate it.
Thank you.
It was a great report, and I'm also liking the whole 8th grade thing, so I know I was against it, but I'm coming around. So
The second thing that I had was a recommendation to consider a family cap for user fees. So it's something that's come up often. So currently our user fee is $175 per sport. There's an individual cap of $500, but there is no cap if somebody were to have 2, 3, 4, 5 children in school playing multiple sports. So the recommendation is $700, which is the equivalent of 4 seasons, 4 full price seasons. I guess if you had one student who played 3, it would be capped at $500, so it would be $675 if the other was there. But $700, so once you have reached your $700, whether your kids are done playing sports or play 5, 6 more seasons, there'd be no additional charge. So if you were to vote to enact that this year, I anticipate being able to make up the shortfall this year, because obviously we didn't budget for that through the return of gate revenue. So we're fortunate so far that we've been able to have fans back, so we're able to charge. So that obviously brings some money in that we weren't counting on 100% when we did our planning last year.
Can I just? So just the committee just got this proposal tonight. It was born out of the meeting we had with the athletics, arts, and activities liaison group. A suggestion from that group, and so we don't need a vote tonight. Peter will do a better job of describing when the next season collection begins. If the committee felt it wanted to vote it tonight, it obviously could. If you wanted to wait to consider it till next month, you can, whatever the committee wants to do.
Can I ask a question? Is the $700 cap per year or like your whole high school career?
So the intent of that would be per year. And in terms of timing, the winter season starts after Thanksgiving. So user fees we typically ask for before the start of games, so the 2nd or 3rd week of December. So there is some time, and there might be some families who might reach the cap with the winter season potentially.
Okay. I think it's great. Yeah, as someone who has 3 kids, 3 seasons, it's a big expense. So if we can swing it financially, I think it's great for families.
And just as a management issue, who would be like watching that? Would it be on your end or on the parents' end to be like, hey, I just cut my last check to you all this year?
So I would assume, speaking from experience, most of the time the parents would certainly let me know when they were paying. just as a reminder, but that's something that we would track, and if for some reason somebody were to pay for an additional season, we would refund them as well. If we didn't catch it and they submitted it either through the online payment and we saw it, or if they submitted a check, just if they weren't aware of it. But we would add it to our registration. I know some people don't always read every detail, but if they missed it, we would be able to refund them.
Thank you. How do you all feel about
I'm
voting
good to
tonight?
vote on it tonight.
I'm good.
You're good. Okay,
Yeah.
let's do a vote.
Abstain for this one because it
Oh.
immediately impacts you.
I mean,
Just
if,
to be,
if that seems fair, sure.
yeah,
Yep.
just-
I see.
Just
okay.
trying
Yeah,
Yeah,
that
that's
makes
fine.
sense.
Keep an eye out
That was
for
my
it.
Do we have to
thoughts.
announce that?
No, you should.
Okay, all right.
You can just say why. You
Okay.
should just say why.
So we are looking for a motion.
Do you want to tell people that?
Oh,
Yeah,
yeah,
we're just,
maybe we should.
just sorry,
Okay.
because this immediately
Okay.
impacts the groom family. I'm just asking Julie if she wants to abstain from the vote, so you don't think she's trying to dodge the vote. She's just trying to not look like.
Conflict.
No
Yes,
conflict.
yes, and I wouldn't have thought of that since I'm a new school committee member, so thank you. I appreciate that.
Like
Don't
any
want
of us
any
That was a good
impropriety
catch. That was a good
happening
catch.
here.
Okay, perfect. So, can I ask, would anyone like to make a motion to institute a family cap to the athletic program at our school per year?
I would love to make that motion.
I'll second it. All in favor?
Aye.
Aye.
Awesome, thank you. That's great for families. Thank you.
How about as presented?
Oh, as presented, thank you. Okay, perfect. Principal report. We have the NEAS visit and Mr. Jonathan Bourne will be speaking about it.
And it's only this big.
Big deal. Should have broken that up a little bit more. Thank you for being here.
Good evening, thank you for having me. Appreciate the opportunity to come speak about our NEASC report. Before I do dive into this, I did want to take a minute to thank Mr. Lanner and the Anti-Bullying Club at the high school. They were able to get John Morello back for his one-man show called Dirt, which he performed last year virtually, and I know we were disappointed to not have him in person. However, credit to John Morello, who was happy to do that for us virtually, came back free of charge to do his live show today, which was phenomenal. The freshman class was completely dialed in.
Yes, they
and
were.
It was a great program, so hopefully they came home and talked about that wonderful opportunity. You did mention the thickness of this report, so I know everyone read it cover to cover. If you did not, what I'd hope to do is just skim through some of the highlights. If I assume maybe at the end, if you had questions about any particular comments or things that stand out in the report, I would be happy to do that. For the sake of the folks here that might not be as familiar, NEASC stands for the New England Association of Schools and Colleges. And what NEASC does is every 10 years they accredit high schools and colleges, essentially saying for our purposes that an Abington High School's diploma is worthy of college admission. They last came in 2010, and they came back in, I want to say in 2018, 2019 for what was called a collaborative conference to meet with stakeholders and leaders at Abington High School to see what we think we needed to do to improve. And then they came back last year to conduct their visit virtually in March of 2021. And that report has been attached and sent to the public library if folks did want to get a hand on that, or you can email me, I'll be happy to give you a copy. If I could skim through, truthfully, the first few pages are essentially cut and paste of things you may have seen, the district's vision, our vision of the graduate, which is a component I know this committee has heard me say before, and I think folks in the community can expect to hear more about, and that's actually one of the recommendations in the report. If I could skip to your page 14 on the report, there are 6 foundational elements among all the standards in the NEAS report, and these are binary elements that you either meet or do not meet, and they are that binary. There's not a lot of room in between. The foundational element we did not meet was to have a consistent curriculum in all formats, or consistent format across all disciplines. We had one department that did not have a consistent format. As the chair, Dr. Baldwin, said, 99 out of 100 is pretty good, but it's not 100, therefore it does not meet. It is a requirement that we anticipate meeting within the next year and a half, if not sooner. If we could then skip ahead, just a few pieces that you may have heard some of the, and Dr. Gonsalves and Mr. Scott and I did not plan on this. The collaborative conference, which happens 2 years prior to the visit, the school identified priority areas that the visiting team then corroborated on. And one of those priorities in area 3 on page 23. On the 4th paragraph down, there was a comment that was very salient to our staff as we looked at it, that students often have a hard time, so this would be in the 4th paragraph, 1, 2, 3, 4, 5th line. Students often have a hard time accepting failure because mistakes come with grades. So it can be hard to balance taking risks and keeping grades up. And I think that's a component that we would like to dive into more as a school, especially as we contemplate students taking risks like taking AP classes and other challenging academic courses. On the next page, sorry if I gave you the wrong page, that was 23. The next page on 24, recommended next steps. Over the next 2 to 5 years, and this is a piece that may have jumped off the page and is something that is absolutely aspirational at the high school, that AHS intends to plan and implement an academic showcase event where we hope we can have our graduating seniors from a future class be able to welcome their parents and the community in to show you what they've learned. So each of our kids graduates with a portfolio of learning experiences that demonstrate how they've met the criteria in the vision of the graduate. Moving ahead, the report then outlines several commendations and recommendations from their visit at the school. And so these commendations are things that this group, which is a collection of educators, in our case, all from Massachusetts and New England, there are about a few commendations and recommendations, and I would like to read through them all if I could. One of the commendations is on page 33 of your report. I apologize for going so quickly. The monitors and interventions for at-risk students provided by the student support team. The mentoring program, where each student is provided with the same trusted adult for all 4 years. The addition of the bridge block that has provided students with the opportunity for school day access to activities such as extra help, making up assignments or tests, and interventions that would previously have been available only after school. Another commendation is the feedback from teachers that provides learners with multiple opportunities to demonstrate their learning, receive corrective feedback, and use this feedback in meaningful ways to support their learning. The addition of a halftime adjustment counselor, which occurred between the spans of that collaborative conference and the visit. This is one that I tell everyone everywhere I go about Abington High School, is the safe and welcoming culture. Many high schools are safe and welcoming. Abington is like everyone else, but more so. There is definitely something about this town and this high school that is incredibly safe and welcoming. Another commendation is the promotion of academic success as a priority by displaying academic banners for student achievement. The active participation that involves students in decisions that derive the direction of their education. The committee was very pleased, especially last year, about the school's ability to continue to provide opportunities, including art shows, concerts, athletics, community services, theatrical performances, and extracurricular activities when safe in the midst of the pandemic. Mr. Serena was no small part in that. I do need to say Mr. Shannon in particular put on a multi-actor musical, despite prohibitions against singing indoors, which involved lip-syncing choreography, all at different times, and it was phenomenal.
Yes, it was.
Another piece, and I got to give Dr. Gonsalves credit for finding this technology, is the use of Microsoft translation tools that embedded in the Teams platform. We basically have live Portuguese closed captioning in every classroom in our school when we can, using that technology. On page 35 are some of the recommendations that we need to work on. These recommendations will fold themselves into school improvement plans that will be determined by the school council at Abington High School. Some of these might become part of a school improvement plan for next year, 2 years, or 3 years down the road. It's just kind of a determination of where we want to go and where we want to go first. One recommendation is to design and provide formal opportunities for representatives, members of the school community to play a meaningful role in the implementation of the vision of the graduate. That might be you. I might be asking you for some help on that. The next is to develop and implement a tiered system of intervention support with formalized roles and protocols. So in our world, or in my mind, that comes into two domains. That's academic interventions, as well as social emotional interventions. And there's generally 3 tiers at what point do most students get tier 1 supports, and then kids that need more get tier 2 and on to tier 3, both for academic needs and social emotional needs. Develop and implement a communication plan that shares the vision of the graduate with the entire Abington High School community. That is something I aim to work with our school council, which will be formed later this week. Another recommendation is to ensure that a formalized teaching and learning plan is executed with fidelity to ensure high-quality teaching and learning is embedded within every classroom throughout the school. One theme throughout the reports is some of the pockets of strong teaching and learning that they saw, and they would like to see more consistent school-wide examples of great teaching and learning. Another is to promote student voice and choice for learning through continued efforts to promote intellectual risk-taking. This is some of what we are actually doing right now as a school. Dr. Federowitz mentioned our current PD on standards, expectation, and motivation. It's actually one of the things we just did on our last half day of the PD is how to shift some of the heavy lifting, the heavy academic lifting onto our students. And I also need to credit Superintendent Schaefer for inviting in TLA for learning walks, where that is also one of the emphasis points we have as a leadership team as to how to get students or help students do more of the academic heavy lifting. Again, formalize a plan that addresses universal instructional practices and common assessment protocols that currently exist throughout the school but lack consistency. Formalize protocols for academic and social emotional learning during the bridge block. I am blessed to have an amazing and tenacious assistant principal in Jesse Clements, who will be working on that this year as we learn how to better use that academic intervention strategy. Also, provide opportunities for professional learning and growth in which educators explore how to design learning experiences that align with the vision of the graduate, and provide opportunities for students to practice these skills in the vision of the graduate and receive feedback on their growth. One of our current school-wide pre-approved, so to speak, professional practice goals is for departments to determine student learning opportunities that happen throughout their curriculum and aligning them with the indicators in the vision of the graduate. We know we do a lot of this work, and this is to begin the process of us connecting what the students do on a day-to-day basis to the expectations we have as laid out in the vision of the graduate. Sorry for all the reading. That is the bulk of the report. I definitely would recommend or be available to answer questions. If you do have a question on a particular page, just please call me to it. I have read it 4 times, but I don't know cover to cover yet. So happy to answer any questions.
Anyone have any questions?
Just a couple, and then I know we'll catch
Absolutely.
up. I got your email super late.
Thank you, no
I
worries.
apologize for that. So I just wanted to point out, you already did on page 60, and I loved the strength of personal connection and familiarity with the school community creates a very student-centered culture. I think that we are a great community, and I love that it shows in our schools too. I think that's representative of a lot of Abington, so I love that. Do we actively teach growth versus fixed mindset?
Do we actively teach growth versus fixed mindset? That is a great question. It is definitely a place where we want to get to. And I think one of the things we're trying to identify is where that stress point is between what kids are kind of expecting and accustomed to from a classroom experience. And it really comes down to the idea and the concept, and what we're working as a staff is to create opportunities for productive academic struggle for our kids. How to respond to, I didn't do well this time, but to be able to do better in the future. We're also looking at grading practices that go along with that, to make sure kids see failure or mistakes as an opportunity to learn. So that is something we are actively promoting and working on this year.
Okay. And then I noticed on page 24, currently teachers report, it's the last paragraph, currently teachers report informally observing each other's classes. Is there any chance that we can make that a part of like the new teacher mentor program, so it becomes part of the culture that our teachers do that? I just know from experience, from my own personal experience and other teachers that I've worked with, specifically one school that I'm thinking of that does kind of require that. They said it was the best professional development they ever got, and I would tend to agree. So I didn't know if that's something we could consider. I don't know if it can be a mandatory thing, but certainly if we start with the newer teachers as they cycle in, it would just become part of the culture.
Thank you. I would say informally, it is absolutely supported in something I would support. If one of our new teachers wanted to view any other colleague in that, I know last year obviously it was put on hold for contact tracing and not having folks go into different rooms. But that is definitely something we can look at. Thank you.
Anyone else?
Always.
Okay.
Won't lie, I had that little page 14 thing highlighted. Just out of curiosity, was the lack of written curriculum, was there a reason behind it?
It mostly comes down to format. It's
Okay.
not the lack of a curriculum, it's just that curriculum was not in the format as prescribed by NEASC for that department.
Okay, so the teachers who are teaching that particular are following some sort of
Correct.
and the students are okay. So that's not.
It's not the Wild West.
It's not as dire as it sounds.
Correct.
Okay, and is there a timeline in which that is required to be taken care of?
They did not give a you need to fix this by. One of the things that's great about NEASC is they have shifted.
I was gonna say, they
shifted their tone.
They used to
from
be
the last time I
really-
was here
yeah.
in 2010, where I think we had about 8 to 10 recommendations. I
Right.
think our last visit they gave us 56.
Yeah.
So 10's fewer and easier than 56. So no, but we aim to not let any foundational element linger.
Well, and anytime you can have more commendations than recommendations, I think really what we can say is congratulations, because this is I've been through these processes. They're huge and they're unwieldy and they're uncomfortable and they're just not pretty. So thanks for everything that you and your staff have done to make that go so much better than what I've seen in the past, quite frankly.
The process has improved drastically.
Good.
It used to be really quite an ordeal, and now it is much, much more informative than it is kind of a process check piece. So
Perfect, thank you.
thank you. And Kim McHugh is one of our English teachers who has been the local steering committee chair, and she's done incredible work, being a through line from 2010 when I was last here till now, to lead this work with the school.
I'll thank her for us,
I
please.
absolutely will.
Anyone else?
No, sorry.
I
Thanks,
just
Mr.
want,
Vaughn.
yes, thank you
Thank
very
you.
much, and congratulations to you and the whole entire staff for all the great hard work that you've done to get us
Thank
here.
you very much.
So next up, we have the report of the Director of Student Services, Dr. Robbins.
Okay, so actually in this case, there's no formal report. This is just over the past few weeks, we've got a few new requests for homeschool programs. So I've taken some time to review all the requests, and they identify specific curriculum and action plans in order to meet the grade level standards for their children. And so the 3 programs that are in your packet, I would recommend that you consider approving. And so now it's up to the committee to vote.
Thank you very much. Can I get a motion to approve the additional home education programs for the 2021-2022 school year as recommended by Dr. Robbins?
I'll make the motion.
I'll second it. I'm sorry.
Go ahead.
All in favor?
Aye.
Aye. Thank you. So next is the report of the superintendent of schools, Mr. Shaver.
So what I have for you under the update on the vaccine threshold and masks, I think are things that everybody that gets the news you already know. That the date for the was October 1st is now been pushed back to November 1st in terms of the mask requirement. As of after October 15th, if we can have a building that's 80% or north of that in terms of vaccinated people, those people are able to be unmasked. It's our hope that we'll be able to, we're advocating, although the middle school, the high school, and the AEEP are all in the same building, we're advocating that the high school be treated like its own building. So as soon as we get to that threshold, we can move forward with that. And we're working on collecting that information through the nurses' offices and through, I apologize, I don't know what the MIIS, the state website for the information on vaccinations. We're using both those methods to try to collect that information so we can achieve that threshold as soon as possible so we can provide that benefit as soon as that October 15th, or as soon after that October 15th date passes. So.
Thank you.
I do have a question. I had a parent reach out asking about, they had a child vaccinated. What is a middle school child? Our parents are being asked to submit information directly to the nurse's office. I believe something's coming out, but.
Something is going to come out. The problem with the middle school in grade 7 and 8 is there's also a 5-6, and that is included, and the shot isn't available to 5th and 6th graders.
Well, they're just wondering
Yeah.
reporting procedures. Should these parents
It'll make
be?
things a lot faster once the middle school is eligible. It'll make things a lot faster. Mrs. Smith already has all the information, the vaccine information.
Okay.
That they're not trying to then reach out.
So essentially parents can
Parents should, if they have them, should always send them to the nurse's office.
send whatever
just for a
information they
record.
have.
Yep.
Okay, thank you.
So what we're gonna do is set up an independent email address that only the nurses are able to use and have access to, so people could actually send it via email if they choose.
Okay.
And then the program, the MIIS, right? That's what you said it is?
MIIS.
MIIS. And so, will teachers,
No.
so
no.
how, okay.
Nurses.
Nurses, okay.
Yep, that's the Department of Public Health's database on this information.
Great, thank you. Anyone else have questions?
No, thank you.
The middle school has been selected as a Microsoft Showcase school. You've got a letter in the packet. The reason that's a big deal is because it's hard to achieve. It means that the middle school is able to collaborate with other schools, and they're entitled to professional development that other people are entitled to through Microsoft. So we made a decision to go with the Microsoft product and their benefits. The tools that we used when we had to go remote, were Microsoft tools. Everybody knows what happens with Zoom and Zoom bombing. We found that there's a higher level of security, and then just as example tonight with the translator pieces, there's also active reading that takes place for our students with disabilities. The Microsoft program has provided a lot of benefits to us that our students are able to use and access. So.
Thank you.
Class sizes and projections. So in your packet, you should have a chart that shows exactly where we are today, this school year. And it shows that in the top part of the chart, the enrollment data is broken down pre-K to 12, and you can see in each grade where the bubbles are, where the averages are as the students move through the system. In the bottom chart, you can see that our average class sizes are in the mid to low 20s. And an average, the lower the class size, the better, obviously. But mid to low 20s is not what you would consider high class sizes. And so, coupled with this, I also have for you the demographic study that we've been doing annually. Abington has seen a boom in growth. And we've also been able to keep more students in the Abington Public Schools than we did ever in the history of us recording the number of students that leave the district. I've got a chart that goes back 50, 60 years. And so the fact that we're able to keep those students in the district rather than having them leave, coupled with the new growth we've had in Abington, has caused us to worry about our elementary level, especially, and our class sizes, both class sizes across the district. So in this chart that's in your packet, the demographic study, you can see what they've projected for us. And they've got a historical enrollment by grade that goes back to 2010. Again, I've got more information in my office going back 50, 60 years. You've got historical enrollments, and there's a bar graph. And then on, I want to call it the, including the cover page, the fourth page, you can see that in 2016, not only have we had a boom in growth, not only have we kept more students, but people had a lot of babies in 2016. So there's a bubble that's hit the kindergarten. Our current, and I've got a kindergarten teacher here to call me out on it, our current average class size in kindergarten is 22. That doesn't mean that we don't have a 23 or we don't have a 24, but that also means that somewhere there's a 20 or a 21. The average class size as of September 14th is 22. Again, we wish that was lower. But we added a kindergarten teacher last year anticipating that bubble coming. Unfortunately, it braced us for what could have been worse. In previous years, it was worse than 22. Especially coming out of COVID, where I know we all want to be, our students have missed things, and the smaller class sizes, obviously, the better we want to have. But if you continue along that same line, this is a projection that was done last year, in November of last year. And you can see they projected the Abington schools to have 2,202 students. And you can see by the other sheet that I gave you, we have 2,162 students. So already this demographic study from last year is wrong. We have 40 less students in the Abington Public Schools than the study anticipated. And so we'll continue to do these studies year after year so that we can get the best information possible. And what they do is they take the number of new housing starts, they take the number of kiddos born in the years leading up to kindergarten, and they track that as best as a demographer can to make these predictions and these projections. So at some point, if Abington continues to grow, we could be talking about construction renovation of school spaces to meet the need. But today, we're not ready to ask that question because we have the space that we need for today. And additionally, I'm aware that there's a moratorium on water, I believe, in the town that may slow down some of that growth. Now, I'm not a city planner. I'm not a member of the planning committee or zoning, so I'm not going to pretend to be and be an expert on these things, which is why we'll continue to do these demographic studies that will try to capture what the anticipated new growth is, so that we can gauge this and predict this as best we can. So we had some questions about class sizes and community, and so it was requested that I update people on it tonight. So
We appreciate that.
that's my update.
May I make a comment?
Yeah.
And I do love the fact that class sizes are lower, and I'm looking at the typical class size for a third grade class right now, which is about 7 fewer kids than what I sat with in a third grade classroom. But education looks, feels, smells, and just completely is different than when I was in a third grade classroom. And I think just as we go forward, these numbers look better, but if we can really make the commitment to try, and there's a lot more individualization now than there ever has been before. This is it's hard to do your job well when you don't have space to move around and do the things you need to do.
So, and a little bit to that point of individualizing instruction, a little bit of a spoiler alert. Later, we're going to talk about ESSER 3 and the addition of staff. And so you're going to see in this a lot of interventionists to work in classrooms with these class sizes so that the instruction can be individualized in the classroom. There's support in the classroom to assist with the gaps and what has been missed for our students and help acclimate them back to where we all want them to be. At the same time, you know, we all know the whole world took this same hit. And so we want to come out of it better and faster than anyone for our kids. But everything's been adjusted across the board for kids, not only nationally but globally. And I'm not saying that we're not going to work to fill those gaps. I'm just being realistic about what we're doing and what we're expecting of our kids, because we don't need to crush them or accelerate them back. We need to bring them back in a way that our kids are resilient, but we need to be thoughtful about it so that we can bring them back the right way and they can feel comfortable with it and be successful as they move forward.
Any questions?
Also, adding classroom teachers, as you'll see, and again, I'm wrecking the presentation later. The ESSER 3 money is a one-shot deal. That's not going to be a part of our operational budget. So the concern I have looking forward is if we use those dollars to reduce class sizes for the next 2 years, they're going to go right back up. And it's better to use those dollars to help our students recover and recoup, rather than build out an infrastructure that we can't support, where we're laying these classroom teachers off and the class sizes are going right back to higher numbers. So that's, but again, I've already wrecked the next presentation. So,
I can go, I can leave now.
so the other item I have is a consideration of a COVID-related sick time, which I need to ask if we can just table for now.
Sure.
We have a TA with the association, with our teachers, but they should have the opportunity to consider that as.
Can you say what TA is?
Tentative agreement. You throw these things around because we use them all day long. I didn't mean to do that. So the association should have the opportunity to consider that first. And then I'll bring it here, hopefully pending successful ratification of the association.
Do you think that was, oh, I'm sorry.
I said thank you.
Do you think that, when is our next meeting, like end of October?
Yeah, it is the end of October, and I may ask if we can do a meeting just for this purpose, so that we can move forward on it.
Okay, thank you, Will. Oh, excuse me, I'm sorry.
Is it appropriate to ask a question follow-up, or can I only do that in visitor section?
Well, I know that you actually have emailed before, so
It was
I think
a
that
follow-up to that
I think that it's probably appropriate right now.
Okay, I just wanted to ask, does the demographic study talk about, oh, do you want me to come up here?
Do you mind,
Nope.
just real quick? Thank you.
Sorry guys, I know you all probably want to get home.
No?
We're here for you guys.
I mean, the news isn't that interesting.
Melanie Whitney, 70 Loganberry Drive. I was just curious if the demographic study goes into the proportion or the percentage of students who are English language learners, and whether there's anything that we can do either on the back end to respond to enrollment or planning for future enrollment.
It doesn't, however, we do know what those numbers are. But in terms of English language learners, it's not only the number of English language learners, it's also the level of language acquisition that they have at any given time. And so what we're doing is we're building out a model that also supports them, you know, in classrooms. We continue to, that's actually where we've added most of our positions, I want to say, in the last 3 years. Special education and in that area.
Okay.
And I can give you a copy of the study, but I think I've answered your question. It's not
Yeah,
on there.
I just wanted to make sure that as teachers, you know, the situation that I have is a teacher is balancing a lot of English language learners. It feels like a lot to me, and I want to make sure that as a community we're supporting teachers with the resources that they need, especially if we've got potential funds that can be used to augment, whether it's curriculum or PD or whatever it is. So, thank you.
It is certainly a challenge for our teachers.
Yeah. All right, thank you guys.
Thank you, Melanie, we appreciate it. Anyone else have questions?
I did have
Oh, sorry.
two things, but I was hoping you could speak to. You want to talk about middle school lunch for a minute?
Oh, sure. So the questions come about middle school lunch and how long it takes to get through the middle school lunch. I think people know that the lunches are free and they taste a lot better than I ever had in school. So they're very popular. And so because they're popular, a lot of kids are getting lunch. And so what we've done is looked at the purchase of, we not only stand there and look at what's going on, and Felicia did that today with the high school administration, but we're also tracking the point of sale information, which is where we record all the transactions. Even though they're free, we still have to record somebody took a lunch. So we're noticing that students have more and more time over the last couple of weeks. You track when the last lunch was served, and then you look at the end of the lunch period. And for example, today, we feel like people had time to eat their lunch.
Correct.
We're getting to a better place. Other things that we're doing, though, is helping to cue the line better. Not seeing, and I had emailed you earlier, one of the things we're looking at is helping students sort of decide what they want to eat before they get to the point where they're selecting a lunch. That speed things up. I don't know if you've ever been in a restaurant and had somebody who's been standing in line for like 10 minutes, and then they get their order and they don't know what they want, and you're standing there saying, I can't believe that you don't know what you want. We've been standing here. So we're also trying to come up with ways to speed up the queuing, but not seeing today that that was the problem. So we're going to continue to track that because we want kids, we don't have time to eat lunch.
Yeah, and that has been definitely noted on multiple occasions.
I was gonna say, can I ask, so Woodsdale,
Yeah.
I think they give their lunch to their homeroom teacher in the morning, and when they go to lunch, because they have assigned seats at lunch, it's sitting there. Is that possible at the middle school? Don't they have assigned seats at lunch?
Too many options.
They do, but we honestly, there are 160 lunches that are distributed in
Each
8
session?
minutes.
Yeah. Okay.
In one lunch.
That's fine.
And the middle school also, middle and high schools have significantly more options.
Okay.
So I mean, that point of sale information I looked at today is why I know that
Right.
they had 150 to 160 on average. And
Per lunch, 160
Per session,
per
right?
session.
per lunch,
Yeah,
yeah.
per lunch.
Per
period.
wave.
And before we go any further, can I thank everyone who's passing out the 160 lunches
No.
per wave? I mean,
And-
it's incredible,
Yeah, you
and
will, Renee.
I know that parents understand and the kids understand, but it has been a very common theme since school started.
And they're eating them. I mean, they like them.
Yes, they do.
And it also depends on what the meal is.
Yeah.
There's some that are really popular that everyone, like.
Popcorn
everyone
chicken bowl
gets.
day, it's a thing.
Chicken bowl day. And quite honestly, especially at the 5th grade, they went from having a choice of, cereal, pizza, or the hot lunch, or just 2 options actually, to now walking in there, they can have there's 6 or 7 options every day. And it is overwhelming. And to add to that, last year they didn't need to use their PIN number. So,
Yes.
or a year and a half they didn't need their PIN number, so it was also relearning PINs, having to look up student PIN numbers, so when they got to the register, they could put their PIN in. But I think we definitely have seen it improve, and hopefully it will continue.
Because it's free, but we're still accountable to report on what we're serving so that
Correct.
we can be
Reimbursed.
audited and
Yeah, we get
accountable
reimbursed
for
for,
the money.
the meal is free to a student, and then we get money back from the federal government to subsidize, to pay for that meal.
Okay, okay.
Breakfast and lunch.
It's a lot of work, thank you. The other thing is if you could just speak to the buses for a minute, because that's been the other, unless that was on here and I didn't
No.
notice, but I don't think I saw it on here, so.
So we're trying to add a bus, talk to the bus company. They're trained, as everybody knows, bus drivers are hard to find these days. They're training someone now. They should be available by the end of October so we can add a bus. So things are better than if you remember when we started, we had construction in town, and it was last week we had a gas leak in town, and it caused delays. And there's a ripple effect or a domino effect that when a bus from the middle school also does a run at another building, that bus shows up late. And if it's 3 buses, there's 3 buses that show up late because our buses do one one loop and then they'll do another loop of dismissals with kids. And so it's gotten better because of the construction's lessened, hopefully we don't have any more gas leaks. Also, just in terms of the students and the drivers, knowing exactly who's on the bus is important. Knowing where they're sitting is important because of the situation with COVID. And so those things took time. And we think there have been improvements already with those things, but it's not yet even where we want it to be. We could improve further by adding another bus. That's in the works. I'm just going to prepare everybody for the winter though. When it snows, the buses are going to run late again because obviously they're working their way through the snow. But in my mind, your students are actually safer coming home on the bus than they are having you drive to come and get them from the schools, but that's up to you. But you can anticipate as the weather gets bad, that's also going to slow things down.
May I add a piece of that?
Yeah.
Additionally, you may remember from a previous school committee meeting, I talked about the number of families that registered for the bus late, or after the weeks leading up to school and then after school started, and the number of new registrations that we had. So in order to provide the best service we could at the time, we put students onto existing buses and existing bus routes. So now we're 4 weeks into the school year. That has slowed down. Now we'll look at all the bus routes and all those additional students and say, okay, this bus has 71 students, this bus has 42 students, they're in sort of the same neighborhood. We can take these students off of bus 18 and put them on bus 14. So there will be bus changes in the next, I would say, week to week and a half that will hopefully also alleviate some of that. It'll definitely alleviate some of the overcrowding that we have in two schools in particular, and it will hopefully also help with the length of a few of the routes.
And you anticipate a larger piece of equipment coming on.
Correct.
So a larger bus.
Prior to, so that it would help us with those buses that are overcrowded until we can resort our routes.
Any questions?
Nope.
That's great.
Thank you.
Thank you, Peter. Good info you brought tonight. Appreciate it. Next up, we have the report of the Assistant Superintendent, Dr. Marshall.
Thank you. I'll let the crowd do it.
Sure. I know it's late, everybody, and same with staff and everything too. I don't know. I know you guys all have an early morning. I don't want you to think that you have to say.
My first item I have for you tonight is a memorandum of understanding with the food service department. As we have done with the other unions and associations in town, we negotiated a one-year agreement with the food service cafeteria association that is consistent with that of the other groups in town, so a 2% increase on the salary schedule. And we anticipate actually looking at the entire food service contract this year to make sure that, to do a full evaluation of the food service contract to make sure that our positions and our compensation is in the average as for those same jobs on the South Shore. So, but what you have in front of you is the Cafeteria Association 2% increase in the salary schedule. And I would be looking for a motion to approve that.
Thank you.
More questions?
Okay. Any questions? No. Would anyone like to make a motion to approve?
I'll make a motion.
I'll second. All in favor?
Aye.
Thank you.
Thank you.
So there was a question or a request for our spending so far on the federal and state funding relative to COVID. So in your packet you have a summary of the spending thus far. It looks similar to that you received, I believe, in April or May. Since the last time we spoke about this, there was an additional $119,000 spent through CARES, and that was for the payment of TECA, which was the secondary online program furniture, additional technology, and sanitizing of our buses. And at the bottom for ESSER 1, there was an additional, again, this is the delta from the last time we talked about it, $20,000 in nurses, and about $1,700 in technology. Are there any questions? Okay, thank you.
So I'm going to kick off the ESSER 3 only because I'll be brief. This is the beginning of the ESSER 3, and so this is a preliminary budget for ESSER 3. This is going to go on for the next 2.5 years, and we're going to continue to get feedback and input. That was the reason for that survey that we asked people to do, so we get some initial thinking and feedback. So we're not done, because this is a grant that's going to, again, once this money goes, it's over. It's for to help our students during this recovery phase. One of the things I'm worried about, two things with this money, in terms of the responsibility I feel I have to the kids in the system is, one, not to really make this about recovery, rather than building out programs that we can't sustain. Because if we build out programs that we can't sustain, we're just gonna tear them away. And when you build a program and then you tear it away, it can be more painful than appropriately managing what you have all along. From unemployment costs to having to reconfigure things for kids midstream. And so we were really intentional about providing support to kids with these initial dollars. So that's my first concern. And my second concern about the responsibility to maximize these dollars for our kids is that as much as I want to be through with the pandemic, we don't know what tomorrow might bring for us. So I want to make sure we burn this over 2.5 years responsibly, so that we don't need something desperately because information changes, things on the ground change with this, and we don't have an ability to react because we don't have the resources and the funds we need. So we need to be consistent with the way we burn it over this 2.5 years. We want to be responsible and use it effectively over the entire time period, but at the same time, we don't want to spend all the money today, because we're not exactly sure what tomorrow is going to be. But the money will be here for 2.5 years for us to expand what we need to do for kids over that time period. If that makes sense. So.
Thank you.
So Dr. Fedorovich and I are going to talk a little bit about the feedback that we got from the community, and then also our preliminary spending plan. And I'll talk a little bit more about how we anticipate doing that, and then feedback.
Okay. So thank you, everybody, for taking a look at the ESSER 3 survey that was sent out. So here are here's an overview of the results for the ESSER 3 survey. Basically, it's the American Rescue Plan Act, the ARP of 2021, which is providing school districts with additional funding for the purpose of responding to the COVID-19 pandemic. And Abington Public Schools will receive grant funds administered through the Elementary and Secondary School Emergency Relief Fund, which gives them the name ESSER. This is the third one, so ESSER 3, for in-person learning and learning loss mitigation. So a survey was made available and public to the community to capture the feedback that assists schools with the district's funding plan. So we had a total of 313 community members take the survey. 91% of the respondents were parents, followed by the second highest category of educators at 5.5%. The remaining participants consisted of community members. 72% of the participants were early elementary or elementary schools, 57% from AMS, 38% from the high school. And it doesn't add up to 100 because some of the participants that took the survey selected more than one school because they have students in more than one school. So in terms of the top priorities for critical focus areas, 3 of the top ranked came out very high. One was addressing students' social, emotional, and mental health needs, followed by addressing the impact of learning loss and instructional time, and the purchase of high-quality instructional materials for students. So I just want to say we really appreciate you taking the time to give your feedback to complete this ESSER 3 survey. It's very valuable to get the community input, parents, teachers, and students also. So the survey is just a start on receiving input from the community for this funding, and we'll continue to get input as we move forward, as this is an ongoing process, and we do welcome your input.
Thank you. So, as both Mr. Schaefer and Dr. Dorowitz said, this is a multi-year grant. So this will be good through September of 2024. And the Abington Public Schools is slated to receive $1.37 million over cumulatively in those years. So we have a preliminary plan. It's preliminary. There's some positions and resources that we are anticipating using and hiring in this current fiscal year, and then there's others that are for FY23 next year and then the following year. Throughout this grant, there'll be opportunities for feedback from the community, from parents, staff, administrators, and the school committee. I would like to go through some of the spending, initial preliminary spending plan. And you will see that these do address, many of them address the survey results specifically. So first we're looking for school adjustment counselors for the Beaverbrook, the middle school, and the high school. Those are positions that we anticipate hiring for to start in January, so for the second half of the school year. A special education teacher at the middle school, English language learner tutors for Beaverbrook, Woodsdale, and the middle school, and math and literacy interventionists for the middle school. Those are the positions right now. There's also interventionists that we have identified for the final year and the school TBD. So we would look at data and decide where we believe those would be best used. Additionally, for instructional supports, instead of reading the list to you, I'll give you the general category. So we have technology that includes such items as iPads and laptops to support student learning. Professional development for staff in the areas of literacy and mathematics. You've heard that we had a very successful summer academic summer school program for secondary students that included social emotional learning as well as academic learning. We would like to continue that over the next 2 years. And also we had enrichment programs in the area of music and fitness also that ran in the summer. There's some money for some facility improvements at the Beaverbrook air exchange for the gym, kitchen, and office areas. And then, as Peter mentioned, we don't know what the future of COVID is, so we've also allocated money for additional PPE and cleaning supplies. And then we have, again, preliminarily, we have set aside $310,000 as unanticipated at this point expenses. So that's money that we will spend, but we have now till September of 2024, and we didn't want to spend that now or have a plan for it now, not knowing what next month will bring or next year will bring as it relates to COVID. How was that for a lot of information?
A lot of good information, though, I guess, right? Anyone have questions? No.
Oh, yeah.
Yes.
Always. The school adjustment counselor, the price tag on that one for the half year?
Yep.
So that's just for the half year?
Nope, that's for 2.5 years. Part-time, 2.5 years.
Okay.
So if you look in column 1, it's half a year.
It says half-time, yeah.
Yep, so, but in the first column, it's identified for the 3 years. So the total cost is for the 3 years.
Okay.
Half year, because we would hire them to start in January.
Wow, I feel so much better. I've literally, trying to keep my eyeballs in my head. No, I feel so much better about that. And that is half year, but these people are assigned to the particular school, not floating, so.
There's 3 part-time.
Okay, and I'm assuming that Woodsdale is not on the list because they're a smaller school?
Yep, we spoke with Mr. Haas, and he felt as though his school psychologists and his social work interns were able to facilitate the social emotional needs of the students at the Woodsdale.
Okay, thank you.
Anyone else? No? Thank you.
Thank you.
It's good work you two put
Yeah,
together.
that's-
Appreciate it.
that's huge.
Such short notice as well. And Peter, thank you.
Don't think we need a motion for that.
And this is something that's gonna be ongoing. You know, there'll be more information on this as we go.
Does that make sense? Sorry, I'm kind of focused on that. My final item is the, shocking when we have to do this in September, but the FY23, so next fiscal year, budget development and article planning schedule. So in front of you, you have the schedule of how we'll develop the FY22 budget. There's a number of items that are still to be determined, but we have heard from the town manager that he's planning to have an April town meeting. So we'll be, typically we'll be presenting our preliminary budget to the school committee. I mean, the school committee will be presenting the preliminary budget the first week in January.
Thank
So
you.
I do need a motion.
Okay.
Thanks.
So, excuse me, would anyone like to make the motion to approve the FY 2023 school department budget development and article planning schedule as presented?
I'll make the motion, Wendy.
I'll second.
All in favor?
Aye.
Aye. Thank you very much for the information you gave. Peter, you have a couple other items to add?
So just under informational, if I could highlight a couple of things.
Mhm.
We have the K through 6 curriculum fun fair scheduled for October 5th. At the last meeting, we talked about changes to Glenowitz that was causing a pinching as traffic was coming in, and the committee asked me to write a letter to the town manager. That letter's in this under informational, and John Stone, and I can give you an update on that. What you've seen, if you've driven up Glenowitz, is that the highway department has taken some of the left-hand side of the entrance to Glenowitz to create this easement so that you can have 2 lanes of traffic until you get to the turnoff. They're gonna see how that plays out. There's I think you call it a patch at this point, an asphalt patch down in that area. What they plan to do is see how that goes and then make that more permanent, if that's a solution. And then additionally, if they need to even stripe that up the middle, creating that 2 lanes, so that cars that wanna continue on and drop off on Glenowitz or pick up on Glenowitz can do that, and then the traffic can flow into the parking lot and pick up at the building or in the parking areas closer to the school campus. So that's that letter, and that's what they're doing. And then the second piece is you've got a press release on the Hall of Fame induction ceremony on Sunday, November 21st. And my son's high school football coach is Bob Bancroft, and he's nominated, by the way. And that's all I have for you that I wanted to highlight under informational.
Can you just highlight this one more time?
I know, right? It went really fast. I agree. I couldn't remember. I had to think about it if he actually said grades K through 6, but I know you did.
Grades K through 6 curriculum fun fair on October 5th, Tuesday night. A week from today, from 6 to 7:15. Join us for a night of teaching and learning in a fun fair atmosphere with games, insights, door prizes. Come and engage in what your student is learning.
Thank you. And that's in the middle school cafeteria.
And we highly encourage participation in this. For years, we didn't have the opportunity, and there were people who fought hard to get these curriculum fairs back in, to give parents a fair shot at having a full understanding of what it is their kids are learning. It's so much easier to have an understanding of the full picture and then see the small pieces of the puzzle. So please families, come on out, grab your neighbor. It will be worth your time, and it's only going to serve to make your students' education stronger.
I agree. It's been a long time since I was at it, but I think it was the first year that it happened, and it was great. There was the whole cafeteria was filled, so it's definitely a good idea to go and see what your kids are learning. And to John Stone and Scotland Basie, I seriously, on behalf of I think all the parents, really appreciate them going and making some adjustments to the road. It's been very helpful. Go ahead.
Just in case
Oh, I'm
I
sorry.
don't get it in there, I only pulled out my phone because I was looking for a message from the president of AEF. She was just asking for me to put in a little plug about the signs that are for sale. Donna, can you help me out because
Good
my
idea.
message disappeared from her? I know she wanted me to mention
October 1st is the deadline.
October
Put in your
1st.
letters for the-
Deadline to support the Abington Education Foundation.
And they're adorable.
And the meeting is October 13th. It's not on date 3 and 2.
Oh, thank you.
October 13th is the meeting.
Did you say November? I'm sorry.
October.
October
Okay.
13th.
I'm sorry.
Town hall. Whichever one.
Always looking for people to join.
Always. Lots of fun.
Thank you for that. Okay, so dates to remember, we have Sunday, October 3rd is the Green Wave Boosters Annual Door-to-Door Drive from 11 to 1 p.m. All the high school students that are in athletics will be going door-to-door, knocking and asking for some money. So Tuesday, October 5th, grades K through 6 curriculum fun fair at Abington Middle School, as Peter said. Wednesday, October 6th is the Green Wave Boosters meeting at Abington High School cafeteria at 7 p.m. Monday, October 11th is Columbus Day, so all school buildings will be closed and school offices as well. Tuesday, October 26th is our regularly scheduled school committee meeting at 7 p.m. And Sunday, November 21st is the Hall of Fame induction ceremony at the Middle High School auditorium at 1 p.m. Just before we close it out as well, I'd like to say thank you to all the departments heads that were here tonight, teachers, staff members, parents, Kevin Tachi, and the administration, and our school committee members for everything. And I really hope that, I believe that we're going to be good. So, anyway, establish of the next school committee, again, that is Tuesday, October 26th at 7 p.m. Would anyone like to make a motion to adjourn?
Motion to adjourn.
I second the motion.
All in favor?
Aye.
Aye.
Thank you.